Osamu Sakura to give us announcements. My name is Dr. Amit Thaka. I'm the Executive Chair of Africa Health Business. It's a pleasure to have you all here. Mr. Osamu Sakurai, over to you.
Thank you very much. Good morning to Kenyan friends. We are now speaking from Japan, and my name is Sakurai. I'm from Deloitte Touche Tohmatsu. Just before we commence the meeting or this event, we would like to have some few announcements. The first one, we have two translations, Japanese and English. So you can choose any channel if you like. And another announcement is that to make the seminar very interactive, we have some functions. So we would like to accept as many questions from the audience as possible. So please feel free to make any comments, advice while they are doing the demonstration or presentations. And the second announcement, time management. Well, we have a strict time management for today's event. So when the time is very close to the end, we are going to let you know let the speaker know the time is running up. And after the seminar, kindly Japanese companies are really ready for some extensive conversations or question and answers. So we can extend 30 minutes after 12 o'clock in Kenyan time for further discussions. And also after this event, we also would like to follow up headed by Japan Business Council for Africa, JBCA, and some other Japanese government agencies. So I think now it is a good time for us to start the event. To begin with the keynote speech by the Cabinet Secretariat. So Mr. Nishimura, a Deputy Director General of the Cabinet Secretariat, the Government of Japan, is ready for doing the opening remarks. So now the microphone over to Mr. Nishimura. Thank you very much.
Thank you very much for the introduction. Good morning for everyone. Dr. Julius Ogato, Acting Head Directorate of Healthcare Services, Ministry of Health of Kenya. Dr. Amit Thaka, Executive Chairman of Africa Health Business. Distinguished guests, ladies and gentlemen, I would like to extend a warm welcome to all of you to this Kenya-Japan AfHWIN Product Demo Day. Last December, Japan and Kenya signed the Memorandum of Cooperation on Healthcare, which is intended to scale up bilateral cooperation. I'm very happy to hold this event, which is a first follow-up to the Memorandum of Cooperation and also an official side event of the second Japan-Africa Public-Private Economic Forum hosted by Kenya. The memorandum was signed as a part of Africa Health and Wellbeing Initiative, or AfHWIN, which was announced at TICAD 7 in 2019 by the Prime Minister of Japan at the time. The initiative aims to contribute better healthcare systems in African countries with Japan's medical technologies and healthcare services, especially through business-based bilateral cooperation. Japan has been maintaining close communication with Kenya since TICAD 7. We sent a public and private mission to a couple of hospitals, a national institute, a national insurance fund, and other stakeholders in Kenya in 2020. Last year, we held an online seminar in which several companies presented their ideas of collaborative projects. Now, Japanese companies are ready to work for the development of healthcare systems in Kenya. And today, they are going to demonstrate 7 key products and services, which may help to solve healthcare issues in your country. Finally, I do hope this event enables all the participants to deepen your understanding of those technologies inspires your idea to a lot of future-oriented joint project. Thank you very much. Enjoy this event.
Thank you so much. It is a pleasure to now for me to introduce to the team the chief guest from the Ministry of Health. I'd like to invite the PS of the Ministry of Health, Susan Mochache, who has joined us today. We know that we had trips. We didn't know whether we would make it today or not. I'm very delighted. The PS is a champion and a lead at the Ministry of Health and has been in the forefront of partnerships, collaboration, and strengthening health systems. So please welcome Susan Mochache, the PS from the Ministry of Health, to give her brief opening remarks to bless this demo event that we are going to have today with 7 organizations that will be adding value in the friendship of Japan and Kenya. Madam PS, the floor is yours now.
Thank you very much, Dr. Amit, and the official representatives from the government of Japan. I have, if you'll allow, you'll just hear my voice and we'll engage that way. I want to take this opportunity to first thank AHB for hosting this meeting in collaboration with partners from Japan, and for inviting the Ministry of Health to be involved in this discussion this morning. I wish to recognize that indeed the cooperation between Kenya and Japan dates back to decades. Kenya has developed a very close relationship with Japan, leading to it being the first African country to host the Tokyo International Conference on Africa Development, which we commonly refer to as the TICAD. The bilateral investment treaty between Kenya and Japan has seen a number of Japanese companies highest in the sub-Saharan countries, which makes Kenya an important base for Japanese companies to expand their economic activities in Africa and strengthen the economic ties between the two countries. Japan, through its country development cooperation policy for the Republic of Kenya, and in line with the country's Big Four agenda, priority for the health sector. And we do appreciate that recognition in our bilateral agreements, that UHC becomes our main flagship area of collaboration. And towards that, we want to take this opportunity to recognize and to appreciate more sincerely the government of Japan, which has immensely contributed towards our realization of universal health with the Ministry of Health under various agreements. One of which is what you have seen was signed between the ambassador for Japan with the Cabinet Secretary for the Ministry of Health. I want to recognize that very close to us, or rather the closeness that we enjoy is even demonstrated by a seconded UHC advisor to the Ministry of Health by the Japanese government through JICA. I also recognize the health policy loan for the attainment of UHC Phase 2, which is an ongoing initiative. We also recognize our collaboration in the construction of the KEMRI Research, Development and Innovation Hub, and several other support and interventions that we have had in our joint collaboration. And amongst those that I cannot forget to mention, which has come by way of support of medical equipment, in addition to the finances that have also been granted to us. I want to take this opportunity to really address myself also to the private sector from Japan, to say that indeed Kenya is the destination to consider and to prioritize in investments in Africa. One, as you have already heard me mention, the fact that universal health coverage is a single important and crucial pillar in the Kenyan government is a key motivator, because that has meant that we are driving a lot of investments to the health sector. Indeed, in the last 7 years, seen a significant in the health sector that has ever been put since our independence over 50 years ago. In those last 7 years, several hospitals have been opened, bed capacities have been increased, health workforce has been expanded, and perhaps just to mention and to demonstrate our commitment and even to demonstrate the scope of opportunities in our country, I would just want to point to what we have done just in the past 2 years alone. In the past 2 years alone, we have opened several hospitals in Nairobi County, or the city of Nairobi, 19 hospitals, all of which have been fully equipped to offer services to Kenyans in the high population areas or the informal settlements. In those last 2 years, we facilities, one with the most modern equipment for diagnostics and treatment of cancer, and the other 3 also being significant cancer hospitals dedicated to treatment of cancer. That is in addition to the expansion of equipment that we have given to our national referral hospitals in the area of cancer, amongst equipment in some of those big hospitals in this country. Also, to just say, even at the county level, because as you are aware, we have the health sector is a devolved function in our government, and we have the county governments running various facilities, and at their level, a lot of investment has been made. Several hospitals have been built, and some we are even stepping in as the national government to support with equipping. And there are many, and I'm sure in these opportunities, even with respect to that. In fact, I may also want to mention we have 8 major hospitals that we are constructing as we speak. These are level 4 hospitals, which will not only be built, but equipped as well. We are also in the process of putting up a modern psychiatric hospital, and the government of Kenya has already set about 3.2 billion Kenya shillings. Somebody will do the translation into what that means in Japanese yen. But money has been put to set up a modern psychiatric hospital, and that is amongst the key projects that the government has prioritized in this year. In addition to that, His Excellency the President also announced and that too is a project that is already in the process of implementation and is just as its nascent stages, and we expect to complete within the next 7 months. So these are just some, but a demonstration of what Kenya is doing in terms of expanding and deepening its investments to provide access and availability. We are also very now focused and prioritized the issue of local manufacturing. Having had the experience of the challenges that COVID-19 posed to us, the challenges around the health supply chain and what that meant to us as far as accessing health products. And towards that end, I hope that some of the outputs out of this important meeting today will be discussions about collaborations with local investors to set up manufacturing plants to produce not only health products in terms of medicines, but to look at vaccine manufacturing, to look at some of the high consumed essential medicines that we as a government are focused to have and to prioritize procuring from our own local companies. So there's a whole scope of opportunities. So without going so much into a lot of detail, because I know you will have a lot of discussion, let me just emphasize the commitment of the government of Kenya in the recognition and the facilitation of private sector engagement in the health sector, and in the will, the strong political will to facilitate and enable and thrive, all intended to make sure that we meet our overall national objectives, because we cannot work alone. We believe in partnerships and collaborations. And with those few remarks, I want to really just appreciate that the meeting is officially opened, therefore, on our end, and to wish you very, very successful deliberations. And we look forward to the recommendations that will come out, whatever you will have agreed upon. And with those few remarks, I thank you and wish you a very good day. Thank you.
Thank you. Thank you, Madam PS. Thank you so much for those very good words. Special invited attendees who are joining this session with us, who are totally and deeply committed to partnerships. I want to thank all of them from Japan and from Kenya who are attending. Osamu Sakurai-san, if with your permission, can I now allow 2 brief comments, 1 brief comment from the Kenya side and 1 brief comment from the Japan Business Council side, before we move on to the business demonstration of the 7 solutions. Can I now invite Dr. Julius Ogato from the Ministry of Health, just for brief comments and reflections before I go to the Japanese Business Council. Dr. Ogato, the floor is yours.
Thank you, Dr. Amit Thaka, the Executive Chairman of Africa Business Health. Thank you, our PS, for the kind remarks. Thank you, the Deputy Director General of the Cabinet Secretariat Japan, and the invited guests. I wish to note that the cooperation between Japan and Kenya is quite good, and we want to appreciate the kind of support the Japanese government has given us in terms of trying to achieve our UHC. In the process, or rather, currently as it is, Kenya provides a great opportunity in areas of investment and in cooperation in several areas, one of them being centers of excellence in care in various streams of medicine, like in transplant medicine, cancer diagnosis and care, and in regenerative medicine. We do have other areas of potential investment and collaboration in digital health, in diagnostic medicine, like radiology and laboratory medicine. Also, we do have potential areas of cooperation in manufacturing, in medicines, hospital furniture, medical equipment, non-pharmaceuticals, dressing materials, digital health, and telemedicine. There are various avenues that can be exploited for investment, like direct foreign investment, public-private partnership, and partnering with local investors. Both the invited participants in health investment, I wish to encourage you to explore the various opportunities available for investing to support the UHC agenda in Kenya. Thank you, and over to you, Chair.
Thank you, Dr. Julius Ogato. That is a good list. It shows Kenya is open for business and Kenya is ready to collaborate. It is now our pleasure to invite the speaker from the Japan Business Council. Today, he has joined us all the way from Japan, and his name is Mr. Yakuta Hada. Mr. Hada, the floor is yours.
Hi, thank you very much, Taka-san. Hello, my name is Yutaka Hada, as a representative of Japan Business Council for Africa. We, JBCA, are working with Japanese government to support Japanese companies' challenge for African market. Our members include startups, small and medium-sized companies, and even large enterprises. Today, our members in the healthcare field will make presentations mainly related to diagnosis and prevention that form the basis of the treatment. Dear Kenyan ladies and gentlemen, I do believe that made in Japan means not only product, but also related people, including our business partners. I hope that today's event will be a catalyst for the interaction between you and Japanese companies and a place to meet business partners. There is still a lack of communication between Japanese companies and African people. I would really appreciate your positive feedback to their presentations. Thank you very much.
Thank you so much, Yukuta Hada, for those collaborative statements. I want to take this opportunity to thank all the chief guests from the Ministry of Health, the Government of Japan, and both the business chambers of Kenya and Japan. Our first presenter, and I'll ask our chief guests to join in and listen, and if they do have to have other commitment, leave at your leisure. I'd like to invite Hilary Mujuzi, who is from AfHWIN, and is going to tell us a little bit about the work they do. And in combination with Forest Japan Medical Center, he's going to demonstrate to us how they present this product. I really want Savannah Shindo and Hiruto Nomura to co-join him in the presentation. Madam PS, Cabinet Secretariat, and all the official guests, once again, thank you for your official opening and blessing this partnership. Hilary Mujize, the floor is now yours.
Thank you very much. We shall now start at the AfHWIN session. In this session, my name is Jose Hilary. I work with AfHWIN, a medical device company, and I'm joining this webinar from Kyoto, Japan. In this session, we want to share with you our solutions towards improving healthcare in rural areas of Africa. So, since it's about healthcare, in the last 2 years, I have been privileged to be introducing these solutions to many officials around Africa, including dignitaries, embassy officials, ambassadors, etc. So, in all of my discussions with them, I happened to get a very interesting comment I want to share with you. As I made my presentation and began the Q&A, this official told me that our solutions are very important for Africa. The reason is because that many people in rural areas of Africa still believe in witchcraft. So when I heard that, I was a bit perturbed. How is witchcraft coming in with medical care? He told me, for example, gout, Gout is a very not so common disease, but it's right now it's increasing in rural areas of Africa. And since gout just appears suddenly, like you go to bed sleeping, you go to bed very normal, you wake up with a very severe pain in your toes or your ankles. So some people tend to believe that this is actually witchcraft or somebody's poisoning me, something like that. Yet he told me that through our solutions, we can actually prevent some of these disorders that are not usually recognized easily without medical testing. So I want to share with you our solutions towards enhancing medical testing and how it can help to prevent these disorders, especially that are not easily recognized without medical tests. In this webinar, I want also to share, to allow me to appreciate our partners, not our partners, but rather our users who are using our devices for the last 5 years, and they're based in Nairobi, Kenya. They will share with us their feedback on our products, and also we requested them to give us a live coverage of their laboratory. This is a very rare opportunity, but I want to appreciate them for agreeing on this. And lastly, I shall share with you our solutions. So I shall now request Ms. Hanako, who is now based in Nairobi, Kenya, to briefly introduce herself to us, and also our colleague will do the same. What she's doing, so please make sure that you can see her, because that's where our main part of this presentation will be held. So please, Hanako, can.
Yes. Hello, ladies and gentlemen. My name is Savannah Hanako Shindo, and I work at the Forest Japan Medical Center, and I am glad to be with you today. And now I will pass the mic to my colleague, Mr. Nimrash.
Okay. Hi, good morning or good afternoon, everybody. Ladies and gentlemen, my name is Hiroto Nomura. I'm an occupational therapist and also working in the Forest Japan Medical Center. It's a very pleasure to attend the meeting today. Thank you very much. Now I shall hand the microphone back to Mr. Hilary.
Thank you very much. Before you proceed, can I just confirm whether you're able to see them?
Yes,
can
we
you
can see them.
You can see them?
We can see them.
Okay, thank you very much for the confirmation. So, so let's go ahead, Hanako-san. Please introduce us the current products in your facility.
Yes. Okay. Hello again, everyone. And now, sorry for all the movement, but we just wanted to show you the products that we have from AfHWIN. So first of all, we have right here, we have the SpotChem E. Sorry, let me just give the camera to the cameraman. Yes. So sorry, I don't know why it's quite zoomed in. Okay. I hope you can see that, everyone.
Yeah, if you can zoom out a little bit. Can you zoom out? So it's a bit too close to your equipment. If the cameraman can move backwards.
All right. Can you see it now?
Yes. Yes,
okay.
We can see the white instrument.
Great. Okay. Yes. So this right here, we have the SpotChem E. This is a dry biochemical device that can measure up to 21 parameters. And so this allows us to monitor various patient conditions.
Okay, thank you very much, Hanako-san. So you have mentioned that the device uses dry biochemical testing. Can you please share with us some advantages of using this kind of technology?
Yes, so this device uses dry reagents. So that means that there is no need of installing water systems that is used for operation of this device.
Okay, that's very good to note there that for this kind of devices, no water system is required, and also complicated power systems are not required. So how is this device powered, Hanako-san?
Yes, so this device is actually powered by electricity only. And you may have noticed it is actually quite compact. Let me just show you compared to my hand. And which means that there is less power needed for this, which also means that it can be powered by flow batteries. And furthermore, there is no special power or drain installation that's required.
Right. So we can see that this device is a standalone device. So no need of extra connections from either water systems or other power systems. So let me also just share this with our colleagues, our audience here. In Japan, due to many calamities, we have got very natural disasters that can occur. This device has proved to be useful during such times because there is no complicated power systems, and also can be powered by even like batteries, like especially flow batteries. These are car batteries, for example. So it has proved very effective. Thanks very much, Hanako-san, for that. So can you go ahead and please show us how this device is operated? Maybe we begin with calibration.
Yes. So first here, I hope you can see this. This is a magnetic calibration card. So this is provided in the reagent box, which calibrates lot and time differences. And this card is actually quite easy to use. All you need to do is swipe it. I will demonstrate now. You just need to swipe it like a credit card.
Okay, so that's quite easy. That's quite easy. Can you please share with us how it has been helpful to your routine business?
Yes, so this card saves a lot of time, which means that we can spend more time providing care for our patients. Also, there is no need to use any reagents for the calibration. Hence, we can use now the reagents for the measurements.
So, you see, so that's very important again for increasing the return on investment. So Hanako-san, is it also necessary for users to prepare the reagents by themselves? Because I know some devices require this?
Yes, actually, with this device, there's no necessity to prepare the reagents, as there's ready-to-use reagents. And now on that note, I think I can show you all how this device is operated. So it's very simple. It's actually just 3 steps. So I've first calibrated, and now I will begin the measurement. So first, I just need to press this. Yes, and as you can see, we have these that come out. I will place the tip in here and the sample in the sample area. If you need to use whole blood, then you will use this, which will be placed in here. And so now the second step is to place this strip, sorry. Right. Yes, so I will place this strip. I hope you can see it. I place the strip right there. And now I just press start. And this is how the measurement is done.
All right, that's very easy to use, I think. So with this, not a lot of time is required for actually training new personnel. So how about the samples used in this device? Does it use whole blood, serum, whole plasma? Because I know in biochemistry, we're measuring these parameters using serum or plasma. How about this device?
Yes, so actually this device can measure all the samples you have mentioned. And moreover, in terms of whole blood, there's no need for pre-treatment, as there is an onboard centrifuge that is within the machine.
Right, so there's an onboard centrifuge within the machine, and even sampling is automatic, so becoming very easy and time-saving for the user. So Hana-san, do you have anything you want to share with us about this device? Any other thing you want us to know?
Yes, definitely. So first of all, the results are very accurate and easy to interpret. The maintenance is very simple. You can do it daily or routinely. And one important thing, especially for us, is that it's durable, which means that it can work well in a wide range of environments, including dusty places.
Right, thank you very much. Medium, compact device, but you get same performance as big automatic analyzers. That is very good, Hanako-san.
Yes, so the quality tests are very assured.
Thank you for that. So we can proceed on that device, I think.
Yes, so right next to this, we have the Pocket Chem Ease. I hope you can see that. Yes, so this is a device. It's very fast, accurate, and simple, and it measures HbA1c. And HbA1c is an important parameter that monitors diabetes.
HbA1c being done within the facility. Are there any reasons or any memories you can share with us of conducting this test within the facility, in-house testing?
Yes, so when the tests are outsourced, it takes a very long time to obtain the results. But when we do it in-house, the tests are immediate. They are given back. The feedback is given back immediately. And this minimizes the burdens of patients, for example, multi-visits.
Yes, especially when patients come from distant areas, right? Mm-hmm. So it's good they can obtain this information in less time. And also, I think this increases their interest to seek medical care, isn't it?
Oh, yes, definitely. In fact, the impact has been positive for our patients, and this has been seen through their level of satisfaction.
Right. How about that scanner you're holding there? I can see the scanner on your left side. What is it used for?
This is optional. It can be used to scan the reagents just to make sure it's the correct reagent that you're using.
Right. Thank you very much. So the reagent and samples. Okay. So I think we're now proceeding to the device.
Okay. All right. So we'll just take a short move this side. This right here we have is the Ocean 11 urine analyzer. This device is automatic and is very ideal for a medium-sized facility like ours. And in fact, it permits fast processing of many patient samples.
Right. How is this device powered, Hanako-san?
Yes, this device, as the others I have introduced, they are powered only by electricity. And just like the others, there is no need of a complicated power or water installation.
Right. So I also know that most facilities that are using, that are conducting urinary testing, they are still actually relying on the experience of the health worker or technician. to interpret the color changes. Do you have any advantages of using such a device?
Yes, so this device is very simple, as the reagent is within the strip, and I will just demonstrate how it is done. It's actually very simple. You just place the strip right here, then there you have it. It starts measuring.
Right. Automatic device, right? Mm-hmm.
Yes. Yes.
So
and
again, yeah, go on.
Sorry to interrupt you. I just wanted to add on that because there's no need to interpret the color changes, anyone can actually use this machine and also understand the results. This means that it reduces human error, and it also reduces us having to rely on professionals such as nurses or technicians.
So I think that kind of system, communication between your patients has improved since installation, isn't it?
Yes, definitely. Our communication has improved and many new patients have come in.
Right. So I think, thank you for sharing with that device. How about the next device?
Yes, so our final device is the Lab 004. This is a device also that is a dry biochemical device. Though it is compact compared to the SpotChem Ease, it is still easy to use. And as you can see here, we can use a power bank, just any normal power bank, to power it.
So yes, just add on here, a power bank of around 2.1 amperes and above can power this device. So Hanako-san, what are the roles, or what do you think this device will play in your business?
Yes, so for us, this device, we want to use it, first of all, as a backup, just in case there's no electricity. And as you can see, because of the power bank, we can use it without electricity. And especially in terms of doing mobile clinics, maybe in rural areas, this would be very helpful. Yes. Yeah,
I know that this device, for now, just for now, it measures 6 parameters centered on the renal and hepatic functions. Is it ideal for your business?
Yes, definitely. These parameters actually enable us to monitor, as you've mentioned, the liver and kidney functions. We actually have patients who, for example, are on ARVs, or those who might have disorders that are not easy to detect, such as gout. And these results from this machine gives us an initial and vital picture of how best we can care for our patients.
Right. So parameters, also the parameters include creatinine, calcium, uric acid, BUN, those are the renal parameters. And for the liver, we have got ALT, AST. So I believe this.
Hilary, could we wind up because of timing? Yeah.
Okay. I thought you have 5 more minutes, but thank you. I shall try to finish 5 minutes. So it's cheaper to undergo such tests than waiting for having to go under cure, because cure then becomes very expensive. But if there's with a medical test, then it becomes very cheap for the patients, and also very ideal for the medical personnel. Hanako-san, thank you very much for sharing this information with us. So right now, let's go into the general feedback. As a user, can you give us any feedback from your side? Because I know most of the users get worried about, the distance between Kenya and Japan. For us, we are in Japan as manufacturers. User is in Kenya. Is there any support given to such users who are in Kenya? What happens when the device is damaged? What happens when there are no controls? What happens, maintenance? Is there any support for manufacturers? Can you please make some comments on this kind of user worries or threats?
Yes, definitely. So as I mentioned earlier, the devices, generally, we are satisfied with them because they are quick, they're reliable, they are durable, which means we can use them in rural areas. And in terms of support, I think even when we've had just a few troubles, the distributors have been very generous with their help. Their support has been very efficient, accurate, and their communication has been very good. And I believe not just me, but my colleagues also agree on this. So we are generally satisfied with these devices.
Thank you very much, Hanako-san, and thank you very much to you, Forest Japan, for allowing us to see these devices in your facility. I know it was a very big decision for you to make. So back to me, I take the microphone from Hanako-san. So briefly about AfHWIN. AfHWIN is a medical device company with 60 years of experience over the years, we have developed many devices, small devices, medium-sized devices, and also large devices. We want to use this expertise obtained within these years to actually add a break to enhancing healthcare in rural areas of Africa, because we believe this is where many people are still living, yet they're not very well supported. For example, if you all know, if you go to how this device are installed, if you go to African primary care centers in the year 2010, for example, you'll find that there are very few devices. But as the years have gone on, more devices have been installed in these facilities. So the next thing will be biochemistry. And with biochemistry, we have developed a device that can actually be able to be used even in rural areas, because they are durable, not sensitive to dust, and can be used by battery powered. So right now, we hope that these devices that you're seeing on your screen, we can ask us how we can partner with you and how we can make this available to improve medical healthcare centers, rural healthcare, medical empowerment with these facilities. Thank you very much for listening to me. That's the end of our presentation. Thank you, Hanako-san, and thank you very much, Dr. Nomura.
Thank you.
Thank
It
you
was
so
a
much.
very, very lively presentation. We enjoyed the camera. Hilary, well done. I want to move quickly. We have the next company on stage called Wink. I'm really glad we'll hear a lot more about the smart eye camera. Can I please invite Shintaro Nakayama and Isaku Shimuzu to take the stage. Over to you. Yes, Shintaro.
Thank you very much.
Thank you.
Thank you very much, Dr. Amit, and then thank you very much. Good morning to everyone, my friends and my colleagues, my new colleagues and my new partners from Kenya. My name is Shintaro Nakayama. I'm in charge of a global business of Wellbeing, and together with me, this is Dr. Isuke.
Hello.
He is a founder and the CEO of our company, and he's also a Japanese ophthalmologist. So let me share my screen so that I can have a brief discussion about the demonstration. Can you give me the authorization to share the screen? I cannot.
Yes, you can get that. Screen. So can the IT team please do unshare? So we move quickly. Shintaro can then share his screen.
Oops. All right.
Go ahead.
Okay. Still not active. Okay, here you go. Okay. Can you see the screen right now?
Yes, we can see the screen.
Okay, great. Yes. Thank you very much. So I'd like to have a brief introduction of our companies and activities, and then the new remote diagnostic model of eye diseases, which we propose with our new device called Smart Eye Camera. We Inc. We Inc. is a Japanese medical company, a startup funded by the ophthalmologist from Keio University School of Medicine, which is one of the most prestigious private universities in Japan. And then Dr. Isuke is the one who actually founded this company and who invented our devices and who is now leading our company. I'm in charge of the business side. And then together with me, I have some of the colleagues from business side. And also we are teaming up with hardware engineers, software engineers, and machine learning engineers. This is our device. It's called Smart Eye Camera, which is a smartphone attachment with which enable to diagnose the eye of the patient, anterior segment of the eye of the patient, with equal function to the slit lamp microscope. I think it's easier to demonstrate how it's like because I have it in my hand. So can you see my screen? Can you see my camera?
We can see your camera. We can see your phone. Yes,
great.
Very clear.
So this is a Smart Eye Camera.
There's a light at the back of you. Can you move a little bit to your...
Okay.
So that the light, that way is better. Keep moving,
okay,
keep moving, keep moving. Yeah, that's better. Go ahead.
Okay. So this is a Smart Eye Camera and this is a smartphone. Okay. So we cover the device like this. And now the light source of smartphone is changed to the light which is necessary for diagnose the anterior segment of the eye. So likewise, it's gonna turn into like street light like this.
Correct.
right?
Yes.
Okay. So we also developed a software application in which you can take the images and capture images, prepare the images, and share the image to the doctors. So I'm going to share the UI of the application. Oops. あ、これできないのかな。I think oh. Okay. Think this is function is limited, so that I could not.
What were you looking for? What would you?
I'm trying to share my the screen of my smartphone to share it in the Zoom.
That might be a bit tricky. If
Yeah,
you show us the screen of your smartphone on holding it, like the way you are, we might be understanding what you're doing. So
okay, great. Yeah. Or I think it's easier to share the documents because I already shared a screenshot of the application.
Easier.
Right?
Okay. Yes.
Okay. So we also developed the software application in which you can take the images of the eye, like I demonstrated, in a very secure condition, and capture images and preview the images, and then asking for consultations with other doctors, all within the software, smartphone software application. And also, the data is going to be uploaded to cloud server. So that data captured through the application is going to be uploaded to the cloud server so that the other doctors or the people from other side place can also view it. And also they make a comment on the captured video. I'm showing the browser right now. Can you see this?
We can see it.
Yeah. So this is kind of the database of my account in which all the videos captured from my software application is stored. So this is accessible from any type of like a laptop or a computers or iPad, as long as you are logged in with a secure credential. So for example, this is a video that I have just taken in 3 minutes ago, and you open it. You can preview the video, for example, like this. So you can even take it, download it to your EMS, electronic medical documents server, and also you can use it for your academic purposes and researching purposes, or you can also demonstrate to the patient. You could also see this part. This is a comment from Eisuke Shimizu Keio. So this is a comment from the Dr. Eisuke. So I'm not a medical professional, I'm an ophthalmologist. But the video taken by me is going to be shared, can be shared by Dr. Eisuke, which is at a different place from me. And he diagnosed my eye by seeing this video. So that kind of remote diagnostic model has becoming possible because of our devices. Okay, so this is a function that we're doing. And then let me explain a little bit about the performance of our device and features of a device. So likewise, the 3D microscope, you can generate 3 types of light, which is necessary for evaluating anterior segment of the eye. First one is slit light, and the second one is white diffuse light. And the third one is blue diffuse light. And likewise, the slit microscope, you can diagnose almost all type of eye disease of anterior segment, including cataract, which has been the major cause of the blindness worldwide. We envision to overcome 50% of our blindness by the year 2025 with our device. Right now, there are 43 million people blind worldwide, and more than half of them are blind because of the eye diseases of anterior segment, which can be detected by our devices. And it is also notable that majority of these patients are blind because of reasons which is curable and preventable. What does it mean? These patients are living in the rural areas and marginalized areas where they don't have any access to the ophthalmologist, and also they don't have any access to the ophthalmic medical devices. So they don't have any access to eye care. That's why they got blind because of diseases which can be cured and prevented. With our devices, we like to make a difference to the situation. So this is what we are envisioning. And then, okay, let me explain a little bit about how we like to make a difference to the situation. So in my experiences in many countries, I think including Kenya, the number of the ophthalmologists is very limited. And most of them are concentrated in the city area. And in rural areas, there are many patients suffering from eye diseases. However, in the rural clinics over there, there are no ophthalmologists. There are no even medical doctors in many cases. And the clinical officers are providing the medical solutions to the patients with very limited knowledge and then experiences. In many cases, it is very difficult for the doctors, ophthalmologists in the city area to communicate with clinical officers in the area because of the many reasons, including geographic difficulty and then the distance difficulty and so on. But with this device, we like to make a difference in the situation by having clinical officers diagnose the eye of the patient with our smart eye camera and capture the images and send the images to the ophthalmologist city area with our software so that the ophthalmologist in the city area can diagnose the eye of the patient in the rural area without actually getting there. And once we detect the patient, which can be treatable for preventing the preventable blindness or visual impairment, we combine them, we brought them to the local hospitals where there is a ophthalmologist, so that we can combine the screening, detecting the patient with eye diseases, and then bringing them to the ophthalmologist in Kenya, so that we can contribute to make a difference to alleviate the world blindness and then visual impairment. Yep. So this is pretty much about brief introduction of my company. And then, but I think many of the participants are related to the medical professionals. We like to briefly explain about that. We already got lots of evidence, scientific evidence of our performance and the possibility of a device. Because we are a startup founded by ophthalmologists, we are very good at crafting the scientific evidence. And then we published it in English peer-reviewed journal and in many with many documents. And this is scientific evidence volume-based survey. We also have a scientific evidence human eye experiments. And also we have been publishing many papers in which we demonstrate the possibility that our device can make it possible. For example, our device can also measure the anterior chamber depth, which is also a good, important parameter to evaluate the risk of the glaucoma attack, low-angle closure glaucoma attack. Yeah, and we also acquired, as a research medical device in Japan, we also acquired CE marking. And notably, we have just acquired registered medical device in Kenya as well. So now our device is eligible for using clinical use in Kenya. Yep. And we've been doing many piloting projects, including Kenya, in collaboration with local doctors. And then right now there we have over like 15 countries project sites with 100 devices. So our device is like diagnostic device. So we like to detect, we can work very well to detect a patient which has eye diseases. So in collaboration with local doctors, we like to combine the detected patients to the actual medical solutions, with which we like to make a difference to the situation of the world blindness worldwide. So this is a kind of end of my introduction, but Dr. Isuke, do you have any comments?
Yes, thank you, Mr. Nakayama. So we believe our device could be a great feature for blindness in Kenya, in your country as well. So if you can able to collaborate, please collaborate us and let's conquer the world blindness together. Thank you.
Thank you so much. We Inc., Mr. Shintaro Nakayama and Izuke Shimizu.
Isuke Shimizu, yeah.
Thank you both for this. I see very many attendants who are part of the Kenya business circuit who understand pathology, both from AfHWIN and We Inc. Let me welcome Christina Lenju. I also want to welcome Daniel Kimani, who's from O Hospital. I know Daniel Mwenda from Mediquip is also with us. Grace Kiraka from Mpisha Hospital is with us. Nyawiran Jeru from Hologic. I know Sweta Shah from Hippomed and Timothy Odongo from Kenya Private Sector Alliance. I'm also very pleased that the Ministry of Health leaders are also with us, Silas Ogutu and Hussein Ahmed, among others like Emmanuel Towet. Please feel free to write a little bit of your chat box. If you do feel you want to ask a question, we can bring you into this side room where we will ask you to speak and open up the discussions. I am very delighted. We Inc., you'll bring lightness and brightness and sight to many people. I'm really shocked that you gave a staggering number of 43 million, I heard, people in the world are living with blindness, and many of them are preventable. And you are part of bringing that solution to them. I am really happy to hear your product. Let us now move to the next presentation. I want to ask if the team from Melody International have joined us so we can hear a little bit about maternal health care. Do we have Yuko Ogata with us? If not, please let's move on to the next presentation. If Christian Beck from ALLM AFIA is with us, can I ask whether Christian... Oh, Yuko, you're with us.
This is Yuko Ogata.
Yuko, we want to hear everything. Hello, we want to hear everything about how women can get better healthcare. The stage is yours. Please tell us about maternal care.
Okay, I'm ready.
Go ahead. Welcome.
May I share the slide? Sorry. Okay. Okay. Can you see my slide?
Very clearly, and it's
really
very clearly. Go ahead.
Good morning, ladies and gentlemen. I'm grateful to meet you all here. Let me introduce myself. This is Yuko Ogata, the CEO of Melody International Limited. We are e-health company specializing in saving all mothers and babies' lives around the world. We would like to talk about safe and secure childbirth for mothers around the world. This is our company mission. Today, we are proud to present a new type remote fetal monitor ICTG. I have been to Dubai now, and I'm joined the Arab Health exhibition now. 140 million pregnant women give birth every year. We are committed to improve the prenatal care level around the world and already working in over 250 hospitals from Japan to Africa.
So I think it's going well. Maybe what you do, right?
As you may have already noticed, there are many issues and risks surrounding obstetricians and pregnant women. In addition to the issue of the lack of medical resources, the risks are increasing rapidly. Have any issue happened to you? There is a shortage of obstetricians, hospitals and hospital bed. Pandemic are up and down. On the other hand, long distance transport, late childbearing, premature birth, lawsuit are major risks. Doctor shortage and few checkups lead to high maternal and child mortality rate. WHO says 2 million pregnant women a year die during childbirth. We know that pregnancy and childbirth can be filled with crisis. I would like to show you all to the new specific fetal monitor ICTG in the slide. ICTG is very different that consists of only 2 transducers. There is no boxy mainframe on a big medical wagon, no printer paper. And tablet or smartphone is responsible for controlling the 2 pink and blue transducer. And where the ICTG is a pregnant woman, cute bear, she is pregnancy. Turn on the 2 transducer and make sure they are connect to the tablet. Then wear the 2 transducer as shown in the picture. The sound of, you can see the sound. This is ultrasound sound. You can see the doctor can check the pregnant woman's data distance. A pink transducer measures the fetal heart rate in the womb. It is an excellent device that makes accurate measurement. The blue transducer measures the degree of uterine contraction. A remote doctor can see this graph in real time and make diagnosis. Instead of OBGY doctor operating the device who diagnoses remotely, ICTG is accurate use by nurses or midwives in underdeveloped areas they are used to using smartphone, so they can use ICTG easily. The core technology of fetal monitor ICTG is medical device with IoT communication technology, lightweight, wireless, and easy to carry. It offers the same high-level performance as a conventional CTG. There are few obstetricians and gynecology in hospital within 150 kilometers of the central in Chiang Mai, Thailand. It is use case in Thailand. ICTG have been deployed in 31 public hospitals to create a referral system that is saving the life of many pregnant women and babies. ICTG referral system was introduced in 46 hospitals in 20 districts across Bhutan on the Queen's birthday. It is use case in Bhutan. It will now be used by and even larger regional referral system in Bhutan. Next, it is utilizing of the delivery in Kenya. We have discussed with doctor and staff at a number of hospitals in Kenya. The following could be useful. ICTG data is transmitted by a communication network. Second, obstetrician easily diagnoses the major data via internet. And built-in battery works well in areas where power is not available. Finally, the system can be installed and used immediately without any special in-hospital maintenance. From last September, we have sent 3 ICTG in Kenya to try out, and we would like to use these first to see how they perform by JICA fund. With the help of a person, Miss Helen, who completed her postgraduate study in Japan and interned with our company. We hope to introduce the ICTG to lots of hospitals in Kenya, and many babies will survive the birth and be baby born healthy. Thank you for attention.
Very clear presentation. I congratulate you on the clarity and also on the beautiful product, lightweight, interconnected. It's very good. I do want to ask whether there is a video that we are playing now. Is this video you want to play, or we go to?
Is it okay to you?
How long
show
is the video?
You the, no.
Sure. How long is the video? 1 minute?
1 minute.
Please
is it
press
okay
play.
To?
We want to see Bhutan.
Okay. Oh, no.
Were you going to show us the case in Bhutan or another city?
Yes. Okay.
Thank you.
It is Bhutan's case.
Let's listen to it. Looking forward.
Kuzangpola nigi da du lawa yimi tishe ni de di transducer se lapina dia ngachi ashi jitsin pe ma chogi be ngachi na sani zukha yimi alukini bebe yimi amtsu tsulu be se rebe nana ila digi kepen so bachira yekmo se wajin alukini bebe amtsu tsu da ti be yimi kangil su gara digi be disena tikti be dazim ila
ICT gibi ngachi menpa disugi 아이규 포나루키 델레 미션 데텔레 나루땅 델레 nga치기 dumsu kecho disugi tabi ta lishumi bachin lishumi se detelе tana se detelе ngachi nale tando se junila
allugi netang di lejumbre dur semela nania tout sajaje go bindolas
Thank you so much for sharing the video. It gives us very good insights on the product and how useful it can be for so many mothers. Yuko Ogata, please be on standby. I'm sure there'll be many questions coming.
Yes, okay.
At this point, I think I'd like to invite Christian Beck Executive Director of AfHWIN AFIA, and Alm, I think that's how it's pronounced, Alm AFIA. Christian, I've met you even before. It's very good to see you back online in this Japan-Kenya Health Business Forum. The stage is yours. Go ahead.
Thank you. Thank you, Dr. Amit. Are you showing my presentations on your side? I know I'll be doing a demo, but I just wanted to know if you're showing on your side.
Either which way is fine. Would you prefer to share the screen yourself and do the demo, or should we move the slides for you?
Yeah, I can do from my side. It's okay.
You can do it from your side. So can the technology team give rights to Christian, and Christian can now upload his deck of slides and proceed with the presentation. We have about 16 to 20 minutes for the presentation of Alm AFIA. So if you can whiz us through, Christian, that would be great.
1 second.
I would also, are you able to share? And thank you also, Abigail Chakava, who is joining us from the Nova side. Daniel has written, he's pleased to be part of the team. And I know that Mediquip Global would be looking at increasing equipment and medical devices across Kenya. So I'm sure you should keep in touch with them.
Osama-san, will you give me rights to share?
Bildad, are you online? Please let us know.
Mr. Christian, you have the rights to share. Please proceed. Just share the screen.
Press share screen and you should be able to.
It's just showing a whiteboard right now. That's the problem. It's not showing my screen indeed.
So
okay,
I think
so share from your side. It's okay.
Okay, let's share from our side. Maybe you stop sharing, and can the IT team put up the slides and walk through the slides as Christian speaks to us about ALLM. Go ahead, Christian, over to you.
Thank you. Yeah, so thank you. Christian Beck, Executive Director for Alm AFIA. We are the subsidiary of Alm Inc. We are currently registered in Nairobi, Kenya. And our main goal is to talk to you about how we use our platform solutions to bring care closer to patients, closer to their homes in remote areas. And in this case, we're looking at how we can strengthen and improve the health system in Kenya using our main platform called Join. Next slide, please. And so our vision, our mission is how do we impact and improve health using technology, primarily using mobile and cloud, as well as combining various data forms, clinical notes, imaging, laboratory notes. We integrate all those various data to be able to provide automated systems so that we can improve health outcomes. And ultimately, we use technology to connect people no matter what the distance is, so that you can minimize or overcome shortage of clinicians. As you know, in our region in Africa, there's a lack of specialists. And what we want to do is to see if technology can help overcome those gaps. Next slide, please. We are active in about 33 countries so far. This is probably increasing as we speak. We're active in North America, South America, Asia, and now active in 4 countries in Sub-Saharan Africa. And we work primarily with the Japanese government that enables us to actually expand our reach globally. We work with public institutions, we work with private facilities, we work with various institutions in the Japanese government, MIC, MEDI, And we also work with other non-Japanese institutions to be able to promote the technologies that we've developed. And our idea is that we want to leverage our technology and collaborate with other partners so that we can bring care to patients that need that information. Next slide, please. And our vision and our values are mission driven, and we closely follow SDG missions so that we are able to deliver telemedicine projects. As of December 2021, we have about 18 global projects that fulfill these goals. We've started 3 in Sub-Saharan Africa, Rwanda, Ghana, and Kenya, and then also in South Africa. And we're in the process of initiating others in Uganda, Senegal, Cote d'Ivoire, Morocco, and Tunisia. Our goal is to be able to leverage the reach that we have through our networks so that we can expand and collaborate with locally established clinicians and facilitate communication amongst healthcare providers. Next slide. So our main concept using technology, aggregating data, is providing doctor skills anywhere, anytime. And our platform is called Join. It's a communication It's a communication platform for information sharing amongst medical professionals. It's ideally suited when institutions, cities, facilities are looking to connect various systems. So whether you have an imaging equipment that's based on from one manufacturer, we're able to interconnect that piece of equipment with other EMR systems. So it's ideally suited for models like hub and spoke models, or when you're looking to connect cities. If you have GE, CE, Siemens equipment, we are able to integrate with the various PACs and CTs for those equipment, and then provide that information so that clinicians that are part of multidisciplinary teams can actually communicate with each other. In this case, we primarily focus on allowing information such as diagnostic images, lab results, and prescriptions to be shared in a multidisciplinary way. We have HIPAA compliance, Japan, FDA approval, EU CE mark, and we are also registering in the various local markets, primarily in Kenya, Ghana, and Rwanda. Next slide. So for us, we are looking at actually breaking down silos. And what, as you know, interoperability is it's not a novel concept. Various people are actually looking at how they can harmonize different information systems so that they can actually create networks of care. And we're doing that with our technology Join. So we are able to use DICOM imaging as our backbone to be able to actually create those integrated networks of care. So we facilitate communication amongst local providers, and then we connect them to our experts who are based in Japan. We work primarily with several large Japanese medical institutions. In this case, GK University is one of our main partners, but we have others also. So this fits well with the concept of transforming locally siloed hospitals and clinics, and then bringing the knowledge of Japanese institutions closer to them to provide them with capacity building and mentorship and facilitate sharing of knowledge. So for us, our technology is kind of like a bridge in these times of COVID, because a lot of healthcare providers are not actually able to travel and meet face-to-face, but they can have access to those mentors using our platform. And it's done through an encrypted software that facilitates information sharing. So our goal is, how do we connect local healthcare providers with international experts so that you have a sharing of knowledge? Next slide. It's ideally suited for multidisciplinary team. If you take the case of oncology, where you have oncologists, surgery, pathologists, radiologists who all need to communicate and have access to the same information so that they can arrive at critically relevant and necessary diagnostic information. When you bring all of them together, they have different perspectives, so they need to have reliable information simultaneously. So our technology Join facilitates information sharing for multidisciplinary teams. It's a secure environment. We've been in existence since 2001. We've had over 3 million cases on our platform, and we are a very secure platform that enables case management and information sharing. So in this case, it facilitates growing that network, as I mentioned earlier, integrated network, especially when you deal with multiple perspectives that require reliable information. Next slide, please. So how does Join help? This platform is primarily for healthcare providers, healthcare professionals. It's not given to patients, although we do work, we do have applications that are actually provided to patients so that they can carry their medical record. But we are mostly focusing on how do we actually increase the capacity of healthcare providers to communicate with each other. We work with nurse navigators and clinicians who are responsible for managing that patient data during patient encounter. They're able to retrospectively collect data from a previous encounter and then look at a prospective analysis so that they can provide the best care for those patients. And this happens in a near instantaneous way because we're able to integrate with different imaging and electronic medical record that facilitates actually uploading those images. So now providers can have access to patient historical data and communicate with each other in a near real-time manner. And this informs pathways which are now driven by clinical guidelines approved by the various regulatory bodies, such as WHO. Next slide. I will give you an example. We've been working with the International Cancer Institute in Eldoret, Kenya. In this case, we're using our platform Join to actually bridge the healthcare gap, particularly in oncology. We partnered with ICI because they're one of the premier oncology institute in Kenya, and we wanted to demonstrate how our system could facilitate a hub and spoke model in a local environment. Next slide, please. So our integrated model was developed in partnership with ICI, and the idea was how do we actually have this hub communicate with the various spokes. They had been doing that using Zoom as we are right now. They do case management, case presentation and case management. Every Monday and Wednesday, the spokes presented various cases, but it was a very informal way to actually communicate. And they took pictures using WhatsApp and shared that with each other, which is an unsecure way of sharing patient information, along with all the other risks that are posed. So our partnership revolved around actually properly documenting a communication channel so that they could now have a case management. In our system, we have a video component for telemedicine, which facilitated up to 50 users to come on board and actually participate in that case. We now started, we primarily started with cancer, and the idea was to expand to other NCDs. The hospital, which is based in Eldoret, acted as a hub. And then we have 12 clinics that are distributed throughout Kenya, and they would actually log into the Join platform. We have both a mobile and a web version of our system that facilitate actually sharing of information. And various stakeholders could participate, from nurses to farm tech to oncologists, surgeons. They could all participate, ask questions, and then be able to receive feedback from the experts at Eldoret. Next slide. ICI has signed MOUs with 12 sites, with 12 counties, as I mentioned, distributed throughout Kenya. And they represent various challenges that we had to overcome from internet, from distances that needed to be overcome so that we could install. But we did all the installations virtually. We were able to do this in a very seamless manner. We don't have any major delays. It takes about 2 minutes to load an image from the northern province to Eldoret, and then they're able to provide the feedback within a minute. So using our cloud-based infrastructure, we're able to connect various facilities that communicate and need to have actionable information so that they could manage patients and receive mentorship. Next slide. Professor Chite, who leads ICI, facilitated the introduction of the program. And we worked with the ICI team to actually train all the users at the various spokes. We trained them on how do they communicate using text and voice messaging, video calling, and then sharing DICOM images. Most, if not all the facilities have some kind of imaging equipment, which was integrated on our joint platform, are loaded so that they could do case presentation in a secure environment. Next slide. And the idea was once we finished with our pilot, we would be able to scale this to 7 other countries in sub-Saharan Africa, primarily Ethiopia, Uganda, Rwanda, Tanzania, Nigeria, and Ghana and Ivory Coast. And so far, ICI has about 500 medical professionals that are actually spread out in those countries. They currently participate in the pilot, and our pilot has been well received. So we think that the use of a platform that could actually create links between various specialties, between various individuals in different countries is going to be how we're able to overcome the shortage of skills and specialists in sub-Saharan Africa. Next slide. We are also developing customized forms because oftentimes what we encounter is that a lot of the local infrastructure, they have different data that they collect during their patient encounter. So we have what's called joint forms. These are digitized forms of paper-based systems that currently exist. And what we do is that we are actually able to integrate that into our platform so that now the ICI team can record and analyze the data later on. So as you have the communication platform on one layer, you're able to add other aspects to create an overarching platform that becomes even more useful for the community. You can determine what data needs to be queried and analyzed based on the needs of the provider. So we have different functionalities that we're building on top of our basic communication platform, but we're able to do much more than the communication, including data analysis, as well as integrate with various AI systems. For example, we're working with a mammography AI company that helps ascertain if an image from a breast could be a mastectomy, could require mastectomy for a woman at a certain age. So we integrate with various systems so that we can facilitate information sharing across different platforms. Next slide. So our idea is to bring Japanese technology and work with our local partners so that we can have tailored solutions. We don't require doctors to be at every facility, but we think that technology could create the feeling of having a doctor at those facilities, and we want to bring care closer to the patient's home. So for us, this is a concept of anywhere, anytime, using technology, using cloud-based infrastructure, so that we can now have access to quality care anywhere, anytime in the world. Next slide. With that, I'll stop. I wish the link would work to do a demo, but it doesn't seem possible right now. But that's okay, Dr. Amit. I'll take any questions.
This is really good, Christian. Your presentation was very clear, And for that reason, I've invited Dr. Josephine Ojiambo. I hope, Dr. Josephine, you can hear us. She's a lead in one of the faith-based organization facilities. She will introduce herself. But Josephine, if you can hear us.
Yes, I can hear you.
You heard Christian's presentation. And as a leader in this health systems, please feel free to give us your comments. Over to you.
Thank you very much. I was absolutely intrigued by the presentation, and I'm so glad that I'm able to now share online. I've pulled off the road because it's really something whose time has come. The National Council of Churches of Kenya, with whom I am working, is undertaking a project on non-communicable diseases that is a continuum of care from community through what we call health action days, providing early screening and diagnosis, referrals to hospital-based outpatient and inpatient care. And in particular, at 2 sites, one in Nairobi and one in Western Kenya. The NCDs that are being covered by this project include cancers. So the area of oncology is a priority, and a special focus on cancer of the cervix. However, we are also undertaking interventions on hypertension, diabetes, and chronic obstructive airway disease. I am delighted to hear about what Christian is doing, and I wonder if Christian would open up the pilot so that we could offer and benefit from the very, high-tech but appropriate technology that he shared at our hospital in Huruma, and also that one in Western Kenya. Most of our challenges are around having specialist care on site for those who do have NCDs. So having the ability to have a doctor anywhere, anytime is really something that we would appreciate. And then further to that, also the need for us to have referrals outside of the country would therefore decrease, because we can get high quality, super specialty care anywhere, anytime with this telemedicine application. Thank you for letting me intervene. I'm hoping we can set up a way to engage after this meeting and take forth this conversation. Thank you.
Thank you.
Thank you, Amit.
Thank you, Josephine. I was there at the launch, though Josephine talked about Christian. And this hospital, if you can open up, let's start talking about it. You and I can discuss on the margins, but at this hospital, doctor anywhere, anytime, I think your solution is apt. So thank you so much, Christian. You've already got many people interested, just like we had people interested in AfHWIN and WeInc and Melody. You can see Kenya's uptake is rather rapid. You've already got an offer for a pilot. It gives me pleasure now to tell Christian I'll be in touch with you. Let me now invite our fifth organization called Ajinomoto Foundation, together with Coco Plus Foundation. I know we have 3 speakers here, and they are on your screen here. It's not a new company. We know them very well. Can I request Takashi Usugi to take the floor? Takashi, the floor is yours.
Thank you very much, Dr. Amit. Can we share our screen? Still, I cannot share my screen.
You can share a screen, just proceed, please.
Oh. No, it shows I cannot do that.
Try and see if you can fix that, Bildad, on using the allow button. And Takashi, you can try again. If you can see the green arrow, is that appearing on your?
Oh, yes, yes, I can do that now. Thank you.
You can see it?
Yep.
Wonderful.
Can you see my screen?
Very clear.
Okay, thank you. Okay, let's start from Kennedy, please.
All right, so greetings everyone. And so as Takashi mentioned, I'm Kennedy Bonfe. I'm one of the directors of Coco Plus Foundation in Ghana. And there will be 3 presenters, telling you our story. And so I will begin by telling you what the Ajinomoto Foundation is doing in Ghana. We call that the Ghana Nutrition Improvement Project, which shows the activities of Ajinomoto in Ghana working to improve the nutritional status of children through public-private partnerships. So we're happy to tell you about the work you're doing and to potentially discuss how the initiatives we have here can be replicated in Kenya and elsewhere. So, as you may know, Ajinomoto is over 100 years old, and at the turn of its 100th anniversary, it established the Ajinomoto Foundation as a public interest foundation in Japan that focuses on 4 business related to food and nutrition. It essentially aims at contributing to addressing social issues. The initiatives are the Red Apron that supports disaster reconstruction. There is the Ajinomoto Foundation's International Nutrition Program. Then there's the Vietnam Nutrition System Establishment Project. But what we are focusing on now is Cocoa Plus. That is the Ghana Nutrition Improvement Project, which is a specific activity of the Ajinomoto Foundation in our country to help address the problem of malnutrition amongst children. Now, as you may know, stunting is a very serious malnutrition challenge amongst children globally. When we speak of stunting, we mean children who are too short for their age, not because of genetics, but because of poor nutrition. And the effect is not merely the fact that the person is physically, like vertically challenged, but that there's a serious impairment of cognitive development. And that, of course, has an impact on the ability to learn in school and eventually productivity later in life. So in the first 1,000 days of life, there's the first 2 years beginning from pregnancy, if any challenge occurs in the health status of the children caused by nutrition, that is irreversible. Unfortunately, sub-Saharan Africa is the only part of the world where we see an increase in stunting over the period. So we're trying to help to address that. In Ghana, up to about 30% of children under 2 are too short for their age. They are stunted. And if that is the case, then the problem I mentioned, with challenges of proper cognitive development, would be encountered. And that would have serious consequences for the economic development of the country. What we are seeing is that, of course, for the first 6 months of life, because of our championing of exclusive breastfeeding, we know that a child gets all the nutrients they need. But beyond 6 months, we introduce complementary foods. But the challenge is that the foods we are giving to the children do not have the appropriate nutritional profile to support the growth of the children. And this is why stunting significantly increases from 6 months of age onwards. So what we seek to do is, how do we respect the Ghanaian local food culture, the kinds of foods that we want to give to our children without compromising on their access to good nutrition. So we sought to do this by introducing a supplement, because the challenge is, if you make a full meal, you may limit the access of children who may not like that particular ingredient. So we sought to use the local food value chain, make a supplement that can be added to the foods of children at the point of consumption. Next slide, please. So our work in the country is in 4 phases. In the first phase, we sought to develop a product that can help address the stunting issue, which I just mentioned. The concept was to use a supplement because, for example, I have 3 children. My first child, if you boil an egg, for the 3 children, the first one will eat the white part of the egg, the albumin, but wouldn't eat the yolk. The second child, she would take the yolk and not eat the white part. And my son, the last child, he's allergic to eggs. So if you make a complete meal like that for children, then you will limit the access of those who may have, particular liking for one or reactions to the other. But if you make it as a supplement, then you are able to add it to any food for children at the point of consumption. And because the supplement, the volume of the product itself is not so much as to invite dislike, among the children. So it is based on locally available raw materials, and it is affordable, just about $0.1, which then targets, those at the bottom of the pyramid, to be sure that we are addressing the challenge. Then the second phase was where we conducted an efficacy study. After we developed the product, we wanted to be sure that it can, in fact, address a problem that we are speaking about. So we did an ethically approved study with children from 6 months of age and followed them until they were 18 months. And we checked the indices of proper growth, including stunting, in order to determine if the product was working or not. And then we also tested the most effective way to distribute the product to those who actually need it. Next slide, please. So what we found with our efficacy study is that, the children who were giving Cocoa Plus compared to those who were not receiving the Cocoa Plus had significant improvements in health outcomes. First, the incidence of acute infection amongst those who were giving our product Cocoa Plus was much lower than those who were not receiving it. Secondly, the hemoglobin levels in the blood was much, much higher for those who got the product than those who were not, which means that we were addressing, anemia situation among the children. And finally, on the issue of stunting, the height for age Z-score was much better in those who were receiving Cocoa Plus than those who were not. So we have been able to scientifically demonstrate the efficacy of the product to address the problem of stunting and also work on anemia and acute infection as well. And these studies have been published in peer-reviewed journals and available for your reading. So the challenge is we've developed the product. We've seen that it works. It can help to address the problem of malnutrition in children, but how do we get it to those who use it? We are facing a challenge of low knowledge on nutrition amongst mothers. And so the way to do this is to engage in behavior change communication so that mothers can see the need to intentionally select nutritious foods for their children in order to enable us address that. And for that, we rely on people whom mothers will trust. And this is why we have a partnership with the Ghana Health Service, because nurses are the most trusted people for health information for mothers. So we've been working with them to ensure that we are able to, educate mothers on good nutrition and also help in distributing the product. Thank you. I'll hand over now to Takashi to continue.
Okay, thank you, Kennedy. This is Takashi with you from Tokyo. From here, let me introduce a bit in detail about collaboration with public sectors. We believe that to create behavior change of caregivers or mothers, public-private partnership is effective. Public sector execute health checking and nutrition education, introduction of Cocoa Plus as a solution. Then private sectors produce and distribute Cocoa Plus to the shops near the health facilities. But in the first stage, when we start studying collaboration with the public sector, which is Ghana Health Service, we frequently visited their health facilities and observed actual situation of nutrition education to get to know how we can contribute to improve as private sector. Then we created simple but practical way of solution for better understanding of mothers about nutrition. We developed some materials for community health workers to educate mothers on ground, like big poster with plenty of visible pictures like this. And also flyers for nurses to educate mothers easily with simple pictures too. After we propose these nutrition education materials and introduce Cocoa Plus as a solution, we implement pilot tests in one district, then later on signed MOC with Ghana Health Service to work together in 2018. On the other hand, we have MOC signed, we needed next step for implementation to conduct orientation sessions in each district. We visited and explained to the directors one by one and introduced our project to community health workers about materials and Cocoa Plus. After the orientation session, the nurses come back to their community and educate mothers and introduce Cocoa Plus. From these activities, we have been trying to create a good cycle of education and behavior changes of mothers. Now the collaboration activity in Ghana is expanding more than 90 districts, covering 35% of nationwide. and the mothers' behavior changes movement spreading to these areas. We think there are lots of trials of PPP projects in various countries, but it is not so easy to make them successful, honestly. Last year, MIT got interested in our successful partnership and interviewed us, both Ghana Health Service and the Ajinomoto Foundation, and had several workshops, analyze our relationships, and then finally they issued a case study last month. We also learned a lot from this case study, and also had the process made us a good partnership stronger. Now let me hand over to Yusuke from Accra here. Thank you.
Hello, I'm Yusuke from Ajinomoto Foundation in Ghana. So not only collaboration with Ghana Health Service and Coco Plus, so we started a new public-private partnership with World Food Program because Coco Plus had approved as a registered to the WFP's food basket. So we officially start a collaboration. That's why, so 2019, we start a collaboration with World Food Program and also Ghana Health Service and provides Coco Plus with a voucher system. And after 2 years now, 2020 October, so we start a project for universal nutrition and health coverage through sustainable system for nutrition improvement. That means relating with African Wellbeing initiative, this initiative. Yes. Go ahead, please. Could you go next, please? Next slide. Yes, because so for scaling, this is a scaling up stage, and at the ticket for the 2019, Ghana has and the Japanese government made a memorandum of cooperation about AfHWIN. And also Kenya and it's become make the MOU and become the very partnership country. So I think this such collaboration will be done in also in Kenya, and we can contribute in Kenya as well. This is an example of our collaboration activities with WFP and other private sectors. So NEC is ICT solution companies are making the ICT device for supporting nurses, and also based in the maternal child healthcare recording book supported by JICA. So we doing the support the nurses' activity and also improve the mother and the children's nutrition status. And we recommend to Coco Plus, and also if the children are serious, so we sent to the hospitals, and the Sysmex has a diagnosis company, and they can monitor the malaria and the anemia. So during this cycle, so we can collaborate together and improve the nutrition and the health status. So go ahead, please. And I think Kenya is also, or we can do such collaboration in future together if we could enter at first, because in Ghana, so we could make the public-private partnership, and so many partners are involved and collaborate together and for the same target, same towards addressing malnutrition. Yes, please. So go ahead, please. So summary is looking for the opportunity to scale out to other countries. That means Kenya. So for example, in Kenya, so we need partnership with, for example, international organization, for example, free voucher system or demand creation. Unfortunately, now the registration approval of the WFP is only in Ghana, but we are trying to expand the approval in Kenya, so East Africa as well. And also public sector. Of course, we need Coco Plus has power, but we cannot do only us. So we need the demand creation and behavior change and communication. The power is very powerful in public sectors. We need the public-private partnerships. And of course, private sectors is important. Firstly, we will try from exporting, but finally, manufacturing and marketing and sales distribution is very important to do localization. So this is the whole sustainable universal nutrition health coverage in Kenya. We need whole partners and conditions. Firstly, similar food culture and nutrition issues. I think this is the same as Ghana as well. So, and also partner within supply chain management. So private companies or other organizations is of course the raw material and make the manufacturers is important for localization. And also partner beyond supply chain management, that means SB, social behavior change and communication and demand creation part, for example, WFP, JICA or other NGOs, and it's important. So finally, this is making sustainability, so low middle income country and relationship with Japan is important. I think that this African Health and Wellbeing initiative is already made and bridged together. I think so. It's a powerful relationship and relationships. Thank you. So now, just December, last December, we had a Nutrition for Growth Summit hosted by Japan. And also next ticket, I think this is a very good chance to start the enter in Kenya as well. Thank you. And next, please. So finally, there are some comments from the collaborators of Ghana Health Service, and also we'd like to introduce how to use Coco Plus. Thank you.
Thank you so much for your presentation and the liveliness of what we learned about nutrition today. I think it's very clear that a stunted growth.
Let's share some movie here.
You want to do a movie first?
Yeah.
Go ahead.
That's 3 minutes and 1 minute. Total 4 minutes.
Please proceed.
We are also ensuring that we are promoting Coco Plus. As you know, we still have stunting is about 18%. We still have about 8% of wasting. We feel that the use of Coco Plus and promoting infant feeding, as we are doing in terms of the nutrition education, that we are also getting support from Ajinomoto. Together, we are able to reduce, in fact, prevent some severe acute malnutrition, and also ensure that malnutrition is actually controlled and eventually reduce stunting. So those are the kind of things that we're doing. So it creates the platform that all the services, growth promotion, growth monitoring is all done using that book.
The child should be exclusively breastfed. It means should be given only breast milk for the first 6 months of life. Then after that, should be fed with the nutritionally adequate, safe, complementary food. Coco Plus serves as one of the supplements that can be used to enrich the child's food. Well, as I indicated, the collaboration with the Ajinomoto Foundation, Coco Plus Foundation, has been very interesting and also beneficial. We expect that if this collaboration goes on, it's really, I would call it a win-win situation. And I think that we would want to work hard so that this relationship grows and expand to the rest of the country, so together we can improve the quality of nutrition and health, because it also provides a platform for giving health information on other health interventions that, for example, we are giving iron and folic acid to adolescent girls. So hope that moving forward we can really strengthen this collaboration. My own expectation is that we would have gained a lot of momentum so that we can showcase the Ghana story to the rest of the world, especially the rest of sub-Saharan Africa, whose conditions are similar to ours, to learn lessons and apply in their own environment. And we can also learn from other parts of the world and improve on what we do.
original Cocoa Mama for plus no sauce.
Commercial here in Ghana.
Mommy, did you know that without the right nutrition, baby can cry and cry and cry?
Hey, my junior doctor, I did not know that. But I know good nutrition is essential for every baby's healthy growth. That's why I add Cocoa Plus to her meals to help her grow strong and smart, just as I did for you when you were a baby.
We know porridge does not contain enough protein, vitamins, and minerals. So we've developed Cocoa Plus Protein Micronutrients Powder to help give them the best start. Cocoa Plus is affordable, easy to mix, and contains nutrients your baby needs for good growth. Cocoa Plus, good nutrition within reach.
This advertisement has been vetted and approved by the FDA.
Okay, thank you very much. That's all from us.
Very good. Thank you. And the message from Ghana Health Services was very clear. Can I thank the Ajinomoto team, the Ajinomoto Foundation? All of you were very good in your presentation. I know that stunted growth leads to a stunted economy. With this product, you're actually going to grow the health and well-being. I'm delighted that with the team from the Japan Business Council, together Deloitte and Africa Health Business, we are going to go to at least 7 countries in Africa. Today is Kenya. We are going to have similar seminars in the other countries in Africa. Kenya is where we've started. And to allow us to go to our 2 presenters, Fujifilm, that you all know very well, and Mitsubishi Chemical Aqua, I want to take a short break and then we can move ahead. If you feel that the break should be skipped and we can have the break later after the presentation, Osamu-san, for the sake of the attendees who are already logged in, I am thinking we should begin and maybe do the health break after. Can I hear from you, Osamu? Could we carry on?
Oh, yes. Thank you very much for presiding. Well, I think as scheduled, we can do a short break with some videos to be shown. Then we can restart with Mitsubishi Chemical Aqua Solutions.
So let's have the short video played. I would urge the attendees to see the Japan-Kenya relationship that's been built. If you can hit play, after the video, we go straight to the next 2 final presenters. Watch this video, which has been prepared by the teams.
Japan and Kenya have been collaborating for over 40 years to develop Kenya's health sector. Health research is one flagship area of this cooperation.
JICA was able to break through a very major block to us in terms of development of research and therefore development of the health sector. Because through research in health sector, you can develop all the other areas. You know, I think what JICA values most is that they do a good job and that they improve the situation. I think they bring with them the Japanese approach. And I think the Japanese approach is a very serious approach to professional work. The Japanese approach, they want to be successful and they do things in a serious way. So without the community level, you cannot have universal health coverage in Africa.
Communities in Kenya face high burden of disease from communicable conditions such as HIV and AIDS, tuberculosis, and malaria. Kenya Medical Research Institute, KEMRI, has been leading research into these communicable diseases.
KEMRI was established back in 1979, and during that time we had a very humble beginning. It was just a mere 5 people, 2 of who were scientists and 3 were just support staff. But later on, with this kind of collaboration and partnership between KEMRI and JICA took it upon themselves to support this development of their infrastructure in terms of buildings and equipment in Kemri. So I can tell you for sure, the entire campus, main campus in Nairobi, which is where we are sitting now, was actually supported and constructed by JICA. The other thing that I should talk about is about human resource development, particularly scientific. Over time, from the initial time that Kemri was actually supported by JICA, there's a lot of training also that has been provided to our scientists. We have about 200 scientists to date that have been trained to PhD, masters and PhD level. And most of these, a large number of these have been trained in Japan.
Scientists like Dr. Alan Olekwala have benefited from the JICA capacity building program.
The strength of having capacity building in African countries cannot be more expounded. And indeed, I am one of the beneficiaries, because in the year 2012 to 2017, I worked under a SATREPS project on development of novel Rift Valley fever and yellow fever kits, and wherein we worked closely with Dr. Shingo Inoue from Nagasaki University under the supervision of Professor Morita Koichi, and also in the Kenyan side at that time, Professor Matilu Mwau, wherein this collaboration enabled me to pursue a PhD in the field of molecular biology.
Dr. Alan Olekwala has also been involved in strengthening regional laboratory capacity through the JICA Third Country Training Program.
The Third Country Training Program is a program that is geared towards assisting African countries, and in this particular case, the theme is building resilience against public health emergencies in Eastern Africa.
The COVID-19 pandemic is an unprecedented public health emergency of our time. Using assets from JICA Corporation, Kemri has been at the forefront in responding to the pandemic. And in November 2020, Kemri was awarded the JICA President Award 2020 in recognition of its regional contributions through conducting research and advancing human resource development. Mr. Komori Katsutoshi, Chief Representative of Kenya JICA Office, presented the award to Kemri on 19th November 2020.
To appreciate JICA. I want JICA to be in the middle. It has already been. It is the one that initiated the infrastructure here. I want them to be in the middle of supporting Kemri, and I think in the near future we will not regret anything about what JICA has done to Kemri and the scientists and the entire community of this nation.
Thank you. Welcome back after the break. Those of you who actually watched the video, talked and saw the relationship that Japan and Kenya have over many, many years, like the principal secretary also mentioned. We've enjoyed good relation. It's my pleasure to now invite Amy Sahara, who is the Chief Manager of Mitsubishi Chemical Aqua Solutions, to take on her presentation. The floor is yours, Amy. You're really welcome.
Thank you. I'm trying to share my screen. Can you see my screen now?
Very clearly.
Okay, thank you. So thank you very much for giving me this opportunity today to introduce about our on-site water treatment system. My name is Amy Sahara from Mitsubishi Chemical Aqua Solutions. Before I begin my presentation, I have a short video to start with. Please take a look. Thank you very much. Here is today's agenda, and you've already seen the video, so I will dive into introduction of company profile. Mitsubishi Chemical Aqua Solutions is a water treatment engineering company based in Japan, but we have a local representative in Kenya, which I will introduce to you later. We offer a variety of water treatment related work, such as engineering of water treatment plants and provision of after sales services and etc. So to provide optimal solutions to water related issues. But today I'd like to focus on this on-site water treatment and supply. So now I hope you have some image of our on-site water treatment system. It's a system that supplies water that meets clients' requirements. We design each system like this, one by one. For example, the water source, it can be groundwater, surface water, etc. And the production capacity, it can be also designed according to the needs. Each system is equipped with a remote monitoring system, so to secure safe and stable water supply. In Japan, we have installed more than 1,300 systems, and the majority of our clients are hospitals who cannot continue their work without the clean water. We have participated in this Africa Health and Wellbeing initiatives since 2019 and joined the survey in Kenya to interview some hospitals about the current water situations or problems to some hospitals. And many of them said that they were facing some challenges in securing clean water, such as water is only supplied 2 days per week. So the hospital buys water from tanker, but the quality is bad for drinking. They also said that there's no clean water for hand washing. And then also because of the bad quality of water, the lifespans of analysis and dialysis equipment are too short. They also said that hospital buys distilled water for medical purposes and bottled water for drinking, but the procurement cost is very expensive. So they cannot rely on municipal water, both quantity and quality wise, but they cannot also rely on bottled water because of the cost. In these cases, our on-site water treatment system will be the solution. I'd like to point out two of the main features today. Our system is small to medium scale, so water intake and water supply pipelines can be shorter than the conventional large-scale water treatment plant. So this will allow us to install our system more quickly in smaller spaces where municipal water supply is a challenge. Another thing is that our system is fully automated and the operation is very easy. And then also the maintenance is easily transferred in Kenya like this. In Kenya, we have conducted a pilot with JICA to treat this turbid river water into drinking water and supply to a residential area near Nairobi. In Kenya, because of climate change, there are many rivers that gets highly turbid after the rain that is too high that the conventional type of filtration cannot handle this turbidity. So in this project, we introduced membrane filtration technology. The type of membrane we used was UF membrane or ultrafiltration membrane, and it works like this. Each string of a membrane is like straw, and on the surface there are tiny pores on the surface of the straw. So when filtration takes place, any contaminants bigger than these pore size, like these bacteria, will be physically blocked, and only the clean water can pass through the membrane. During the pilot, we conducted water quality analysis on both raw water and treated water. And these colored cells means that the parameters are exceeded the Kenyan standards for drinking, such as E. coli, turbidity, iron, and manganese. As you know, the water contaminated by E. coli will cause you diarrhea. So obviously it's not good for your health. But after treatment with membrane, all of the parameters went below the standards, so it's now safe to drink. We have done another project with UNDP in Kenya, and the ultimate goal of this project was to improve the quality of life of local people. For example, increasing their income level and access to clean water. We have the technology to make this water clean, but that alone cannot realize better access to clean water. So we combined with agriculture component in this project. For example, and most importantly, this one, a dissemination of traditional leafy vegetables that are indigenous to Kenya and highly nutritious, so they can sell as cash crops. So with the income or the profits they earn from selling cash crops, they can now buy our clean water. So this is how we developed the sustainable business model with the local people. Here are the outlines of the project. Since there was no electricity in the village, we introduced slow sand filtration system that uses only gravity to treat this river water into clean water. And again, the objectives of this project was to improve safe water access and to improve local people's income level One of them was conducted by selling water through water kiosk like this. And the third objective was to make local people healthier by clean water and more profit by agriculture components. 1 year after the project, we have interviewed 50 households, both inside and outside the beneficiary community. And 70% of the interviewees answered that they consumed our clean water. And all of them used the water for drinking, but none of them boiled or chlorinated before drinking because it's clean. And some of them even mentioned that they have saved 17,000 Kenyan shillings per year on medical fees because they have now less waterborne diseases. As for the agriculture part, 100%. All of the interviewees answered that they have now consumed the traditional leafy vegetables, and not only consuming, but they also sold at supermarkets nearby. Because the vegetables are highly nutritious, some improved health situation, and also they could increase the income level, so they could buy water and could also pay their children's school fees. So those are some of the results of the impact assessment we got. In summary, our company provides appropriate technologies to make clean drinking water, and then has experiences of water treatment projects globally, including Kenya. And then we provide solutions to water issues, including climate change adaptation and rural water supply. So we are looking forward to working with you to increase safe water access in Kenya. As I mentioned before, we have a local representative called Environmental Technology Africa in Nairobi. So if you have any inquiries, please write to AfHWIN or to myself from here. Before finishing, I have another short video on rural water supply in Kenya. So I hope you like it.
Did we lose the sound from that video? Emmy, something?
No. It's sorry, the voice is very small.
No problem. So
But they're not speaking. Not speaking.
that is fine. So we can watch exactly how she's taking the water back to her place of residence. Where was this video taken? Which town?
A village in Machacos County.
A village in Machacos County. Thank you.
Habari yako? Ati wewe unaitwa nani? Masi Kinywa. Masi Kinywa anafanya nini kwa mtambo? Wewe ndio unasafisha huku. Aha. Aha. Ndio maji kuwe safi. Kwa hivyo watu wanakujaga kukunywa maji huku kuchota.
Wanakujaga wanapenda sana kwa sababu hii maji haina chemical.
Ni safi.
Si kama ile ya mtaro.
Sio kama ya mtaro.
Ya mtaro iko na chafu nyingi sana. Na ya mtaro.
Hiyo ndio ya mtaro.
Ndio maji safi.
Hiyo ndio maji safi. Hebu linganisha, weka pamoja tuone.
Unaona?
Okay, inua juu kidogo. Hivyo. Inaonekana ni safi. Kwa hivyo watu wanakujanga huku kuchota.
Wanapenda sana. Kwa sababu hata ni cheap.
Ni cheap.
Kwa sababu kununua dukani shilingi 30 kachupa. Na mimi nauzia lita 20.
Shilingi 10.
Sasa wanapenda sana.
Wanapenda sana. Wanasema faida yao kwa hii maji ni nini?
Yao ni safi. Na inatengeneza mwili kwa sababu kulikuwa na wadudu walikuwa wanawasukua kwa tumbo. Sasa wakati walianza kunywa hii maji, hiyo shida ikaisha.
Okay. Wahimize zaidi waendelee kukunywa hii maji.
Wahimiza.
Asante sana.
Haya.
Okay. Okay, asante.
Thank you very much for listening.
Thank you so much. I think clean water.
It seems like what? Sorry. I cannot show my face on the video, but it's okay.
Yeah, that's fine. You can do stop sharing.
Yeah, that's fine. Okay. Thank you very much for listening. That's all for me.
Emmy Sahara, your presentation was very clear. We liked the video. It's clear that clean water, clean hygiene, good practices are reducing healthcare burdens. We've even seen it during sanitization and social distancing, and I hope we keep it up. Let me, at this point, ask one of our guests who has joined us here in our forum, Josephine Kibara from the National AIDS Control Council, to come in and just say a word or two, and before we move to Christiana from Fujifilm. Josephine, are you able to hear us? We want to welcome you from the National AIDS Control Council. You might have a comment or two. Over to you. Give us the comments to our team from Japan or a question, and then we move to the final presentation.
Thank you very much. I really appreciate the presenters. That was good, awesome, and well thought of. There was a presentation on maternal women wellness that we were taken through. In 2 comments, I'm wondering whether are there any thoughts on in the Japan Business Council, do we have any firm that has thought through improving HIV outcomes, including coming up with cheaper or rather affordable equipments that we can take then again to remote areas, especially on maternal, because mother-to-child transmission is an issue of interest. And also, are we even doing anything in terms of helping Sub-Saharan Africa to afford equipment and including also medical products that are HIV related to just try and make the costs more affordable, getting in mind that we've been here for quite some time and other epidemics are evolving, and also bringing issues of resource competition in terms of what we need to prioritize. Thank you, and over to you.
Thank you so much. So the Japan Business Council, that's a question for you. I know today we've had maternal health from Melody. We've also had eye care from WeInc. AcRay brought too many diagnostic products, telemedicine. So my point to Mr. Yutaka Hada is let us also find innovations around HIV care. Josephine is from the National AIDS Control Council with the Ministry of Health. There is a clear ask. So Josephine, we've heard you. Yutaka Hada, do you want to respond 1 or 2 points from your Japan Business Council in health?
Yeah, thank you very much for your comment. Let me check about your point out theme among our members, and then I will feed back to you.
Fantastic. Thank you, Josephine, for that ask. We care about people living with HIV/AIDS. Yes. We want to do things. Thank you.
Thank you,
Mr. Hada. I want to bring on the floor Christiana Hunold. I think, she's the Strategic Innovations Manager and Clinical Marketer for Clinical Marketing and Education at Fujifilm. MEA. MEA, I think, stands for Middle East and Africa.
Yes. Thank you very much, Dr. Amit.
The floor is yours. We know Fujifilm so well. Many people refer to Fuji and the word film, but you're doing so much work in healthcare. Tell us more.
Yes. Do you allow me to take the screen over? Yes. Let me share my screen. And I believe almost there.
We saved the best for the last, maybe.
Thank you. It's a pleasure. It's a real pleasure. So I believe that all of you must be able to actually see my presenter screen. Is that correct?
Very clear.
Thank you very much. I have really learned a lot in today's session, and I'm thrilled with all the solutions all the previous speakers had provided. And I'm really looking forward to providing some more ideas and solutions for the Kenyan healthcare system. And we're talking most of the times today about the artificial intelligence solution in healthcare. So my name is Christiane Hunold. I'm here in Dubai. We've just finished the Arab Health Week, which most probably some of you know. And I'm responsible for the strategic innovations for the Middle East and Africa region. So let me take you through my ideas and the products and the solutions we want to highlight what we can provide for the Kenyan market. Most of you most probably know that AI is taking over in medical business. Taking over means the implementation of artificial intelligence in healthcare. There are a lot of new opportunities and there are a huge amount of benefits as well. I just give you a few ideas here on the list that AI can support the junior residence doctors in taking a faster decision, as well as a learning tool, of course. Positive influences the early detection of cancer and drastically shortens the diagnostic time for emergency patients. It opens new opportunities to drive healthcare solutions as home care solution, remote healthcare services. And we have, and that is something I will showcase later on in my presentation, we have opened a purely AI-driven healthcare and lifestyle disease facility in India called Nora. AI is an essential part with a rapid growth and potential, and one building block in new service designs. Fujifilm provides a wide range of portfolio, as you can see here. It's a massive amount, and I, of course, cannot go into all the details of all these single products, what has an implementation of AI. But I will pick a few to run you through ideas, and the ideas, of course, planting the seed if that would be a valuable addition for the Kenyan healthcare market. Mammography screening. I know that Kenya Ministry of Health has been looking into screening options since quite a long time. I've been traveling to Kenya on multiple occasions and talking about the options of screenings. Of course, there is always the idea to have a screening workflow with a digital mammography unit. Certainly analog with a CR solution that is usually under a discussion point in Kenya as well. But what can we do in terms of mammography screening workflow support with the artificial intelligence? Artificial intelligence is embedded in our mammography system and provides an automated report for 2D images, but also reflects the AI evaluation on 3D. So when I talk about 3D, we're talking about tomosynthesis images. So what can the AI help you with? What can it provide? We have mentioned in an earlier presentation that the lack of radiologists is a very critical stage in Kenya as well. And when we run screening programs for mammography, we usually utilize minimum 2 to 3 experienced mammography readers to undergo the procedures and guidelines on the first and the second reader protocols of mammography screening. We facilitate the artificial intelligence as a peer, as a support for the mammography reader to bring in a faster decision and a more precise precision in the screening workflow. We utilize the artificial intelligence on multiple platforms, and I've just listed here 2 different user voices which we have created in our region, one from Egypt University Hospital, the other one from Ministry of Health here in the Northern Emirates of the UAE, where the common practice on screening and screening workflow is implemented by the AI workflow. So what does it actually do? Officially, the guideline says that the first reader needs to read the 2D images, and then the second reader will not have a look into the first reader's report, makes up its own mind, and then when those decisions do not match, the third reader will take place and call in all the readers and discuss the case and evaluate the case if any suspicious finding is in place, so further follow-up needs to be done. So our colleagues from, for instance, University Hospital in Egypt, they have redefined the workflow and they utilize the AI as a second reader support, whereas the Ministry of Health in the Northern Emirates utilizes the AI as a first reader support. So what does it actually mean is the accuracy of the reading is significantly improved. And in both sides, there is a shortage of experienced mammography reading radiologists. So here again, the shortage of the professional radiologist is one of the key or turning points for the implementation of AI as a possibility to grant a better service to the patients and provide a better care for the person in the earliest detections of this awful disease, breast cancer. I would like to move forward and talk about another product where we have implemented artificial intelligence. Going away now from the mammography equipment together with the AI, we are now heading into the portable X-ray units. So here this very compact point of care mini mobile unit doesn't really need much of a power supply and provides X-ray applications wherever you go. A very flexible, portable machine where we have the chest AI implemented, as well as the opportunity to implement an AI for bone fracture support. So what does it actually mean in detail? As you can see, and I will later on show you a little video about the performance on this product utilizing the AI. The chest AI provides an evaluation of 10 of the most significant lung diseases. And of course, it can support tuberculosis screening, then COVID-related lung disease detection support can be utilized on ICU and ER. And it facilitates the opportunity to have an immediate result displayed, especially for the ER doctor or the ICU doctor who can't wait for the radiologist to read a chest image. The AI will help you right on the spot to take a decision for the comfort and the best outcome for the patient. So I hope that video plays for you. Sometimes buffering is a little bit of a difficulty while those online meetings, but here we have this ultra portable X-ray unit in use of an ICU ward. And as you can see, that's a COVID isolated ICU. And the doctors, seeing the results immediately after exposure, they can take the decision straight away on what shall take place for this particular patient in the next stages without first having to consult the radiologist. Of course, the consultation towards the radiologist is still a need. There's no question about it. So what we are trying to focus on is an immediate support as a workflow changer to provide better services, better diagnostic services for the patients in need. Moving forward, I would like to talk about another product, FDR Air is it called, and you can see here on the screen this very little tiny handheld device is actually an X-ray machine. Hard to believe, but that's true. This ultra portable X-ray unit takes healthcare services anywhere and every time. We utilize it for tuberculosis screening in very remote areas. We utilize this device for home care diagnostic services. And of course, it meets the needs for COVID-related lung disease detection support, as well as in remote services. So this product pleases basically the X-ray services outside of a hospital environment. When we talk about dose here, both of the just current mentioned products, they operate on an extremely low dose, very low dose generators where the exposure is so minimal that we do not need to be afraid of any radiation in the close surrounding. And I will show you just now a video where we utilize the X-Air mobile unit and the screening of coal miners in tuberculosis. It's one sample case in Punjab in India, and the project aims of providing the TB screening and case management in very remote and rural areas. So what we do is, you see it's fast forward as it would just take too long, but you can see here it's an open X-ray setup, and the open air setup X-ray over here It's very mobile. We have a small trolley case where we put all the equipment in. It can be taken literally anywhere at any time, provides chest imaging, but not only chest imaging, but also all other X-ray services. But the AI implemented into this system is supporting the chest analytics. Talking a little bit more into detail on the chest analytics AI, I go one slide back to showcase here the AI report of one chest X-ray. The chest X-ray will be reconstructed in an artificial intelligence software server, and the report will be sent out here as a heat map overlay, secondary capture, for instance. And based on the heat map findings, you can basically identify the abnormality score, and the abnormality score is mentioned on the report as well. We facilitate lung disease findings, starting, of course, with tuberculosis, consolidation, pneumothorax, ribcage fractures, heart widening, and so we are counting on 10 different lung disease findings on our chest AI. Let me take you into another product where we have implemented artificial intelligence. The CT, computer tomography, is equipped with multiple of our artificial intelligence softwares. We run very low dose CTs for lung screening. So we utilize basically the CT as a lung screening tool. The additional functions, brain stroke AI, kidney stone AI, and multiple other functions for lung AI are implemented into the Synapse 3D. We call it Synapse 3D. It's a reconstruction software version which provides 20 plus artificial intelligence application. Why? To make the workflow for the reading doctor smoother. You all know that reading CT images and MRI images takes a huge amount of time. Here again, the amount of reading radiologists is most probably quite limited. AI can help you in reconstructing the diagnostic images in a very efficient and straightforward way and represents the results with one click. So that's another beautiful way in our IT healthcare solutions to provide a smoother workflow, a more precise workflow, and at the end of the day, delivering a better healthcare for the patient. We should not forget that the artificial intelligence is already a major attribute in screening workflows in general. I've just listed here a few samples where we have implemented the artificial intelligence, the chest AI or the mammography AI into screening workflows. One of our directions in AI is an AI-driven healthcare and lifestyle disease center. As I've mentioned probably earlier already, it's called NURA. So what do we do? It's a new aspect, it's a new direction of healthcare services, what we provide. And in this NURA lifestyle and healthcare center, we provide cancer screening as well as lifestyle disease detection within 2 hours only, 120 minutes. The patient, or in this terms, the guest, will have to spend in our facility to undergo all the cancer screenings, what you see here listed, from colon cancer, breast cancer, lung cancer screening, prostate cancer, leukemia, and so on. And it tackles all the lifestyle diseases as well, from liver health, coronary heart diseases, metabolic syndromes, and. So how do we do that? We have equipped the NURA Healthcare Center with our equipment including all of our artificial intelligence solutions. So that is one sample case, how healthcare can shorten the time of the patient to find the conclusion on the status of well-being. I'm happy to talk later in a breakout room more into detail about the neural healthcare systems. Where else do we implement artificial intelligence and screening programs? We provide solutions for colorectal screening, for instance, starting with the stool tests, the endoscopy, and the CT solution. So we are providing the consumables, technology, and IT solutions for every stage of a colorectal screening program. The endoscopy solutions. We're working together with our endoscopy platform, our new AI endoscopy technology, which is called BLI. The BLI provides an identification during the live scan, during endoscopy solutions, identifying malignant surfaces and malignant lesions, highlighting it, steered with an AI in color codes. Moving forward, Fujifilm provides IVD, in vitro diagnostic solutions as well. Our expanding portfolio is not only covering the dry clinical chemistry, but also the rapid diagnostic tests. We provide a fecal immunochemical test and biomarkers, analytics for liver screening, for instance. Here as well, we have AI integrated into our products, especially the WACO products. The next part of our product portfolio should not be forgotten, of course, is the ultrasound. Ultrasound sections called Sonosite, and we do have multiple ultra-portable solutions. I just want to highlight here two. That's the H2 and the M Turbo. So this Sonosite is a very compact portable ultrasound unit, very lightweight and easy to use. It's an ideal partner to be used in remote areas. The origin of the Sonosite is basically based on a development for the military. So that is the focus on ultrasound units in Sonosite, to be portable, extremely durable, and even droppable. So there's no calibration or maintenance needed in those systems. And as I said earlier, it's a perfect tool for the rural use. There's one thing I would like to highlight here. We do have a project in Kenyatta Public Hospital, and this project is ongoing already since quite some time. It's a train the trainer program where 2 physicians got already their certificate. With Sonosite, you get lifetime free online trainings as well. And it is suitable for the OB and gynecology. So most probably that could answer one of the earlier questions during these presentations for women's health, OB and gynecologist as a portable ultrasound unit, adding value to your particular needs. The second last point I would like to highlight is the home care solutions. Again, here an out-of-the-box thinking how we can provide home care solutions for very rural areas where the patients are just not able to either leave the house nor, of course, go into a hospital environment to get certain checkups done. So with all the equipment we provide, we can set up medical examinations, for instance, blood pressure, x-rays, ultrasound, glucose measures, and including medication delivery and blood sample collection. So we have a fixed system which is connected to an HIS, hospital information system, as well as a PACS server, which captures all the data and provides a teleradiology and telehealth service as well to support the remote aspect of those health services. Last but not least, I would like to talk about our Fujifilm Academy. Fujifilm stands in the region for education, and we have opened a facility here in Dubai, which is called Fujifilm Technology Center. And a part of this technology center is a fully equipped radiology department, which we utilize for our Fujifilm Academy. That means the Fujifilm Academy is a base for us to train, of course, our engineers in the entire region, the clinical staff, the clinical application specialists. We are hosting workshops, events, and of course, we don't only do that physically at the technology center, but also are able to broadcast our knowledge transfer into the entire region. So with this, I would like to close my session, and I'm of course happy to receive any questions I can help you with. Thank you very much for listening to me.
Thank you, Christiana. Does that conclude your presentation?
Yes.
It is a real wide range of solutions. Honestly speaking, it was even difficult to keep up with the IVD, home care, colorectal. What this shows is Fujifilm is actually a conglomerate, and it's a comprehensive. What would be really nice is I personally would like to walk through the whole Fujifilm lab health system. I would get everything checked.
Yeah, as you said, it just shows the wide range of innovations we showcase. And I would like to highlight here as well that, yes, we do have already put thoughts and we apply all these innovations to other regions, but we are an innovations team here, and we tailor solutions to local needs. So we are pulling equipment and softwares together to recreate new solutions, whatever is needed in the market. And I think that is one of the bottom lines on my presentation with all the wide range. And I could keep talking most probably for hours on elaborating even more details on more products. But the bottom line is that we do have everything what we actually need to recreate new solutions, new workflows, and make it work for the customers in need, and of course the population which takes the benefits out of it. Thank you very much.
Come to that. Thank you so much, Christiana. I really want to thank all the presenters. I know it can take long. We've taken quite a bit of time. But you know what? I don't feel exhausted. I thought 3 hours at a Zoom call, I would be falling flat and maybe I can't listen to people anymore. But I feel the participants, attendees, and everyone has been very, very good. I would like to literally just ask one question to Melody that has also come up, and maybe even to Japan Business Council. People are looking for an obstetric ultrasound for remote areas, which is lightweight, easy to use. Dr. Yuko Ogata, do you know anything like that in Japan Business? Please give me a quick response if you know of some solutions like that.
Okay, I'm Keiji Ninomiya from Melody International. Can you hear me?
And this has come from the Ministry of Health, a question that has come through that's asking for portable, lightweight, and that's from Hussein Osman. Obstetric ultrasound for those working in rural areas. Maybe Christiana, even Fuji, do you guys do something like that?
Yes, we do. And it was on the third last part of my presentation, the Sonosite solutions, ultra lightweight and portable, which has been, the development's been based on the military needs. So that is the range I've shown, the H2 as well as the M Turbo. They are equipped with OB and gynecologist transducers, and is actually a perfect candidate for the rural applications for ultrasound.
That's wonderful. I'm very happy that we were able to touch a little bit of that. On the arc ray side, let me start with a small few comments that have come through. We are now officially into the Q&A session, and I'll ask our team to go back to the master slide presentation and let me know if there is an online demo questionnaire. I assume right now you've all got the questionnaire. Can you all see the link on the chat box? May I request you, if you see the link on the chat box, to click it. If you can click it right now, and this will take you directly to the survey. It's a simple questionnaire. If you can type in these details, it'll give us information as we strengthen this relation between Japan and Kenya. Not only between businesses, but between governments, and including some information about how the presenters did that you heard today. Thank you for your indulgence. Victor, have you shared the link?
Yes, I've shared the link.
How long will it take for people to fill it in, roughly?
2 to 3 minutes.
Thank you so much. I think with that 2 to 3 minutes, I'm also quite happy to now welcome Malus onto the call. I hope our managing director is now on the call. Malus, are you with us now?
Oh, sorry, I was on mute. Yes, hello everybody.
So Osamu-san, Malus Kibacha and yourself will now take the final stage of the closing ceremony. I know we will have the officials coming through from the Embassy of Japan. I know Kitagawa is joining us soon. Osamu-san, is he here now?
Well, it seems like we are still waiting for him to join. So can we, or just for the time being, we can carry out the question and answer for maybe for the next 5 or 10 minutes. Then we can move on to the closing remarks officially. Then once again, we come back to the extended question and answer sessions afterwards.
Fantastic.
So
So can I ask you, Osamu-san, to take on a bit of the Q&A and ask some of the Japanese questions, a few of those, and then we will move on to the official ceremony. Would you be able to do that for us?
Well, yes. Okay. Thanks very much. Well, so I think Dr. Amit was about to talk about some questions from AfHWIN, questions to AfHWIN. So, well, just taking over that kind of conversation. Well, we would like to raise some questions to county or sub-county ministry or Department of Health officials, like regarding how demanding such products are for, let's say, the medical practices in the rural areas. Well, I wonder if there is anybody representing from the sub-county level of the Ministry of Health. Yes. Oh. Let's see. So I think it's better to change question a little bit. So let's have a look at the questions posted on the chat box. Well, let's see. I think there was one question regarding the contact information of the presenters. Well, I'm going to tell you later, but those contact information will be shared by AHB to you after the end of this seminar, along with the presentation slides. So thank you very much for your question.
Osamu-san, I think Kitagawa-san has joined. So maybe we
Oh,
can,
yes.
in the keeping time in mind, we can move to the next
Right.
agenda item. And as you said, I believe we will share, AHB will share everybody who has registered the contact information of the 7 presenters. And if you have any specific questions, also you can follow it up after the event, and AHB is happy to facilitate any connection there. So just in the keeping time in mind, and given that we are running over, I suggest we move to Kitagawa-san and listen to that, and then we'll wind up this interesting session. Is that okay? Yes. Okay. So
yes,
please.
I think it's okay to us. Yes.
Okay. So Kitagawa-san, I hope you can hear me, and yeah, we can see you upside down. Don't know if you can change your camera. Yes, perfect. We are very honored for you to be joining us after this interesting 3 hours that we have had exchanging solutions, ideas, innovations in the Japanese and Kenyan healthcare space.
Good.
Osamu, maybe you want to do the proper introductions, and then we are very eager to listen to you. So thank you for being with us.
No, thank you very much, Program Director, and my sincere apology for being late. But I hope I'm just still not too late. So let me say a few words on behalf of the government of Japan, I mean the embassy in Nairobi, Kenya. Ms. Susan Mochache, Principal Secretary, the Ministry of Health, and distinguished participants, let me first express my gratitude to all participants for their interest and commitment to this webinar, demonstrating healthcare-related technologies and services by Japanese companies. I'd like to extend a special thanks to the Ministry of Health of Kenya for its continued commitment to work with both the Japanese government and private sector to improve the health sector in Kenya. I also wish to express my appreciation to all the presenters from the Japanese companies and the experts who participated in today's event for your willingness to work together to contribute to the health sector in Kenya. Finally, I would like to convey my sincere thanks to the organizers of the event, colleagues from the Cabinet Secretariat of the Government of Japan and the Japanese Business Council for Africa, as well as the event coordinators, Africa Health Business and Deloitte Thomas LLC. The Embassy of Japan in Kenya is honored to be part of this collaborative effort to increase the engagement of the private sector in improving the health sector in Kenya, as well as ensuring effective implementation of the Memorandum of Cooperation, or MLC, in the field of healthcare and wellness. In my closing remarks, I would like to say a few words on this MOC, which comes under the Africa Health and Wellbeing Initiative signed between the government of Japan, Kenya and Japan last December, following discussion since 2019. This MOC, as you know, marked the start of a mutually beneficial cooperation in the health sector to establish tailor-made and sustainable healthcare system in Africa, based on the principle of human security. The initiative includes the drive towards the attainment of universal health coverage, the USC, which the government of Kenya is aiming to achieve as part of the Big Four agenda. Since Kenya independence, Japan has been a strong partner of the country, especially in the health sector. Please allow me to share with you some detail on the 3 areas that our official development assistance primarily focuses on in the health sector in Kenya. Number 1, strengthening of the health system. 2, pandemic preparedness. And 3, human resource development. First, as of our efforts to help strengthening the health system, we have been supporting Kenya through a health sector policy loan for the attainment of USC and economic and social development programs. The total amount of this assistance is approximately 10 billion Kenya shillings. Secondly, the government of Japan has supported a proactive approach to pandemic preparedness in Kenya, especially in the fight against COVID-19 in recent years. We provided over 125,000 PCR test kits, epidemic preventive smart robots, and cold chain equipment to facilitate the wide and effective distribution of vaccines. Additionally, Japan this week announced a donation of another 537,600 doses of AstraZeneca vaccines to Kenya through COVAX. Last but not least, we recognize that the most important part of assistance is to strengthen human resource and transfer technology for sustainable development of the country. With this in mind, all the assistance provided is supplemented within capacity development programs. African solutions to African problems. The MOC under Africa Health and Wellbeing Initiative is a great example of how we can work together towards our shared goals involving traditional and non-traditional actors and introducing new technologies, including those pioneered by Japanese companies. For example, 3 Japanese technologies from 3 Japanese companies were introduced to Kenya through the Sustainable Technology Promotion Platform, STEPP, of the United Nations Industrial Development Organization, UNIDO, with the support from the government of Japan. These 3 technologies, a gasification incinerator, mobile PCR inspection system, and photocatalyst coating, have been supporting Kenya to fight against infection diseases, including COVID-19 since last year. We are delighted to have the further opportunity to collaborate with the private sector. These collaborative partnerships will assist in the efforts of finding African solutions to African problems, tailor-made to suit Kenya. I hope this webinar has been a positive learning and networking process for you to take back with you important new opportunities for partnerships in the health sector. We thank you for the contributions you have made to our partnerships through your participation. Japan will continue to cooperate with Kenya bilaterally and multilaterally to improve the public health system and services across the country. The embassy here in Nairobi will certainly keep the door open for any consultation by both Kenyan and Japanese sides and make necessary follow-up on the implementation of our partnership based on this MOC signed last December. Asanteni sana. Thank you very much.
Thank you very much, Kitagawa-san. We really appreciate you being here with us and sharing your words of wisdom and the strategy that you have been implementing already. And we are very thankful also for the partnership with Japan. Before we end, I also want to share my gratitude to everybody who participated in this and who made it possible. First of all, the government of Japan, your embassy here in Nairobi, Japanese embassy, also JBCA, the Japanese Business Council here for Africa, and of course, Deloitte in Japan. We are proud to be associated to you as AHB and working with you, and we are very looking forward to fostering partnerships. And partnership is not a one-way street, it's a two-way street, as you know. So from the Japanese side, we appreciate it, but also for all the Kenyan participants that joined, for example, the Ministry of Health, the Honorable Mochache, the PS that joined us today and her team, in addition to all the other parastatals that joined the webinar, the panelists that spoke from the Japanese side, but also from the Kenyan side, and also the private sector participants that have been available and listening throughout the 3-hour session. So on behalf of AHB, but I think I can also speak on your behalf, Osamu, thank you so much. Osamu, I don't know if you would like to add anything from your end before we close the session. If so, please go ahead.
Oh, yes. We were thinking of extending the question and answer session for the time being, maybe for the until 12:30 Kenyan time. Right before we come back to the Q&A, maybe you can still
Okay.
continue your announcement. Yes.
That's okay. So I wanted to share something in the light of partnership, and maybe you can move to the next slide, something that you might have heard of that is happening here in Nairobi on the 24th of February. It's the Africa Women's Health event that we are organizing here. It's a Pan-African event. It's a full day, fully focused on the role of the private sector in advancing women's health. And I believe that the 7 companies that have presented their solutions during this session will also really benefit from participating in this session. It's a hybrid event, so it's in person as well as online. Online registration is free, and the in-person event is at the Trademark Hotel in Nairobi. So you can go to the website africahealthbusiness.com. That's the symposium website, and you'll find more information, or you can reach out to us. And we can help you. But I think in the light of partnerships and fostering private sector engagement, but also solving public health issues that are also very current in the women's health domain, we believe this was worth mentioning. And then we also want to draw your attention to the next slide. That's a private sector driven event in the middle of the next year, the Africa CEO Forum. It's broader than just the health sector, but it's a key event where the main CEOs that are running businesses in Africa are coming together. So we wanted to share that information with you as well. But yeah, Osama, as you said, let's move back and do some more questions if we have. I don't know if I have access to all the questions here. Osama, do you see some questions that you can take up and then handle them? I have a bit of a limited view, I believe, from my end. So I wanted to, as Osama was looking for a question, I wanted to also re-stress, please click on the link that Victor sent in the chat box. You don't have to fill it now. You can even do it after the session is done. It will give us good information in terms of how did you experience the session? Are there any companies specifically out of the 7 you want to be in touch with from the Kenyan side? And we can help you with the follow-up for that one. So please don't forget to fill that in. You don't have to do it now, but even once the session is closed, you can copy the link and fill it at your own convenience. If you look at the chat box, I see Victor has shared it again. So please feel free to do it, and then we can help you even better with the linkages afterwards.
Well, thank you, Maros, for like the introduction. So, well, it looks like we don't have like remaining questions anymore. Although we have already answered, I mean, some Japanese companies have already answered directly to the persons who raised the question. Thank you for your cooperation. So, well, I think like rather than spending more time, we can probably come to the end of this event. So can you move on to the next slide just for the closing, announcement. And I think there is one more slide for the follow-up things. Well, okay, so yes, I will use this one. So for further communication, like I told you, well, the companies who did the presentations kindly shared with us the contact information so that you can also directly communicate with them. And the list of the contact information will be shared by AHB later, along with the presentation slides. So for technical questions, you can ask the presenters directly. And more kind of general or wide range of questions can be also taken by JBCA, Japan Business Council for Africa. So feel free to drop drop an email to JBCA. And for follow-ups, we really want to keep the dialogues for making more like business between two countries. So yes, please do not feel hesitate to contact us. I mean, either AHB, JBCA, and other persons. So, well, once again, thank you very much for your time. And it was very enjoyable 3 hours, or even more than 3 hours. So let's keep communications to each other for like bettering the business conditions between the two countries. So yes, this is the ending note from our side. So thank you very much. So yes, thank you very much.
Great. Thank you, Osama-san, and thank you, everybody. We'll be in touch, and I think this is the beginning of great networking and even stronger relationships in the Japanese and Kenyan healthcare sector. So thank you, everybody, so much. Onwards and